possibly for the purpose of giving direction. We only have one microphone here that picks up for Community 7 television in the middle of the room. So if you're speaking in the room, please make sure that you are speaking loudly and in the general direction of the microphone so that everybody can hear you on Channel 7, and also out in Zoom land for anybody who might be watching. Also, for the council's benefit in particular, I'll just call your attention to the agenda for any member of the public. Our agenda is always available on the city website, and you'll see 4 items on our regular agenda tonight. In addition to what you see on the agenda, we will ask our city administrator for an update on the BBWA ditch situation. I just talked with Chris, and we'll try to do that toward the end of the meeting during council discussion so that we can get right into the meat of the meeting. If we want to have a little bit of a time budget, though, I'm anticipating that our discussion about COVID-19 and that update may take as long as 15 minutes. Probably about 30 minutes for the presentation on number 2, the Fire Center Public Safety Management Report, plus perhaps as much as an hour for discussion. Budget wrap-up, probably about an hour. Public safety mill levy, we do not have a presentation there, but it'll be an opportunity to get a bit of a status report and questions. All in all, it should move, that part should move quite quickly. But if you add all those things together with the ditch update, it'll probably be at least 3 hours, 3 to 4 hours. So I'm hoping that we'll be able to wrap up with a break somewhere between 8:30 and 9:30. I'll try to remind the council where we're at with that rough schedule as we go along. With that, then, finally, I'll just give my thank you to our city staff and any members of the public and council members who attended and contributed to the Centennial Park grand opening this weekend. Thank you very much. It was great success, a little hot, but the dogs really appreciated the new dog park, and their owners did as well. So it was a big success, and again, thank you for everybody who worked hard on that project, which is not completed because, again, it's just sort of a skeleton of the park at this point. We still need lots more amenities in the way of playground equipment, picnic tables, shade structures, more trees, more landscaping, but it's a great start. So thank you again, everybody who contributed, and in particular our city taxpayers, because it was their dollars who paid for most of that. So with that, I'm going to turn it over to City Administrator Chris Kukulski before we jump into item number 1, the COVID-19 update. Chris?
So thank you, Mayor. So just wanted it doesn't necessarily need an introduction because we're all familiar with Pepper Valdez, our Assistant Chief, who late last week was named our next chief of the department, but I wanted to just touch real briefly, and then Pepper's got a few statements or some things, some ideas he wants to share. So you met, we had 27 candidates in total. That's the strongest competitive environment we've had from the 3 department director positions that we filled here in the last 6 to 12 months. A lot of folks interested in leading our fire department, I'm sure based on its reputation and our growth in our community. And where 5 of them were kind of semi-finalists, and then 2, Pepper and then Matt Love out of Florida were brought in, and several of you got to meet the 2 of them for kind of the final step of the process. At the end of the day, Pepper's vision, his overall relationships necessary to implement that vision in our community were really the difference. Both candidates were exceptional finalists for this job. So with that, we're really excited. I was excited to announce Pepper as our next fire chief. And with that, I'm excited to work with him and have him become a part of our executive leadership team at the city. So with that, I'll turn it over to Pepper for a minute here so he can share some thoughts he has with you guys.
Chief.
Thank you, Mayor, Council. I am honored and humbled to have been chosen to lead such an incredible and talented organization, to keep our promise as a fire department and forever vigilant within our community day and night. I look forward to continuing strengthening positive working relationships with our brothers in blue and all other external and neighboring communities. I'd like to thank my family for all their support, Chiefs Rash and Hopple, and all the 911 center in our department. I'm excited to roll up my sleeves and get to work with the outstanding team that has already been put in place. Chief Rash has laid the foundation and put us in a good position that we, as an organization, never thought could be possible. It is now up to us to carry on what he started and try to improve upon it. I have seen many changes within my 2+ decades on the department. We still have much to do, but I promise this organization is on their way. I want to know that each time you see our men and women out in public, you're seeing what exemplifies professionalism and that these professionals are dedicated to our community's safety and success. And any success I have, I owe to the men and women that proudly serve. In closing, I will pledge to you that the Billings Fire Department will continue to provide the best service possible and continue to seek ways to improve, as our community deserves nothing but the best. Thank you.
Chief, thank you, and on behalf of the council and our community, let's give the soon-to-be new chief a round of applause and appreciation.
So, Mayor, if I could, I just have a couple other brief items to touch on. First, as you mentioned, I think best for time management, we'll save the Billings Bench Water Association update for the end of the meeting, but needless to say, past couple of weeks, a fair amount of work has gone into that, unanticipated, but in particularly the last 36 hours. And so with that, I just want to thank Public Works, Fire, Police, all the emergency service providers, the county, BBWA, and the Red Cross, all of which what they did in the past 36 hours was implementing plans and strategies to deal with the emergency that was certainly critical. So we'll talk more about that later, but I just thought in case folks missed it, I want them to know this was not any one department or any one organization. All three organizations, county, city, the Billings Bench, Water Association, Red Cross, and others all responded to that. Last two items in brief. One, and you'll start seeing this more and more in the public. So Billings is accustomed to the better part of a century, more than a half a century of one-way streets downtown, and in fact is still a relative newcomer. I can't tell you, there's been more than once I found myself on a one-way street the wrong direction. Two of those streets are going to get flipped to two-way. The date of that is June 21st. So you'll start seeing a whole lot more public service announcements and education of the community that 29th and 30th Streets will go back to two-way streets after, I don't know what the date is, but I'm going to guess every bit of 5 decades of being one-ways. Those are going to flip back to two-way streets. And so just keep that on your radar. And we look forward to what we hope to be good economic impact as a result of those two-way streets as they become more amenable to retail, commercial, residential, and other foot traffic. And Mayor, you hit the last one, which is on the public safety levy. As I mentioned before, we would put that on each agenda just in case we had something to talk about. I don't have anything to present there tonight. Our focus really has been on that first reading for next week, and I suspect we'll swerve into some of the topics when we get into the CPSM report on the fire side tonight. So with that, I'll turn it back over to you, Mayor, so we can get into the agenda.
Okay, thank you very much, Chris. With that, we'll move on to item number 1, our COVID-19 update from our County Health Officer, John Felton. John, it's all yours. John, we're barely hearing you. We just have to turn up our volume on this end. Give us just a second. Try that. Give us just another minute. We have to kick the computer. Or the computer operators. I'm not sure.
Try that.
Go ahead and try that, John.
How, is that better?
Perfect. Thank you.
Okay, great, thank you. I will go through some data pretty quickly. I'm going to concentrate on some stuff towards the end. So let me share my screen here. You all see the full screen there?
Yes.
Okay. So I'm going to go through these first few fairly quickly because you'll see when you look at Montana, we've been fairly steady for several months. If you look at Yellowstone County, we can go back, 3 full months or heading into our 4th month of being at a really steady level of cases. We continue to be at or below the 15% of the state's cases. That's our population level. When you look at Yellowstone County in comparison to the state, you really can see how long we've been in a pretty steady state of cases. This looks at the cases per 100,000 per day on a weekly basis. So that yellow line is 10 per 100,000 per day, which for Yellowstone County is about 16 people. We have been really, that 16 per day plus or minus 5 really for a long time. This last week came down a little bit. This has some to do with reporting and testing this last week, because this past weekend was the first weekend that the state stopped testing on weekends. So we'd expect to see some more cases in the next day or two that are really sort of catch up. Our age cohort remains very constant. I keep reminding you of this, that's 2/3 of our cases are in that working age adult group, that 20 to 59 group. Keep that in mind when we talk about vaccinations here in a minute. This graph shows you the percent of cases on a weekly basis that were people aged 19 and younger. And this particular graph goes the full school year. So this is what we saw over the school year. There was a trend towards a slight increase by having those kids together. But again, I remind everyone that even though the so-called experts said we shouldn't have opened our schools, we did, and our schools did a great job of staying open, keeping those kids and their staff safe. And so I'm really glad we made that decision as a community to open our schools and make it available, in-person school available for those who wanted to do so. This looks at us on a monthly basis. So the blue bar is the total cases for the month. The orange line is the average cases per day, and the gray line is the cases per 100,000 per day. And again, when you look here from March, April, May, and into June, you see very steady levels. This is through yesterday for June. The other place that we really watch closely is the burden on our healthcare system. And this chart looks at the number of inpatients in our 2 hospitals that are admitted for COVID-19. And you can see in the last couple months, we have come up a little bit, like through May and in the early days of June. We were quite a bit lower here in March and April. But these levels are very manageable by our hospitals. We've got plenty of resources. We haven't had to go into any sort of surge capacity or anything like that for a long time. And here you can see on a monthly basis the average census. Our peak back in November. And again, remember this is just COVID-19 patients. So we have all the usual heart attacks and strokes and trauma and injury and all those other things that go on. So we were close to 140 patients a day in our 2 hospitals in November. That came down to about 13 in March and April, was about 22 in May, and is a little bit higher than that. It's about 26 just through the first 7 days of June. Again, the slight increase, but very manageable for our hospitals. This is where we're going to start talking about our vaccination. So the green bars are the people who are fully vaccinated. Again, a reminder of the definition, that means people are at least 2 weeks out from their final dose. And then the blue bar is the proportion of people who have natural infection. And bear in mind, there is some overlap in here. There's also some people who are not shown on here and might have been asymptomatically infected but haven't been vaccinated. But if you follow the slope of that curve, you really see it flattening out. And we're into what I've called the slog phase. turns out CDC has now adopted that same phrase. So, but it really is the slow going of the vaccines. And this particular chart shows it really clearly. When you look as you go to the right along the time, you're really seeing this curve flatten out compared to back here early when the demand was quite high. This period of time, like end of March through the end of April, was a time that we had plenty of doses and really high demand, and then you see the demand really start to flatten. So back here is where we were serving largely the very vaccine receptive population. We're now into the vaccine hesitant. So these are folks who are still trying to make up their mind. They maybe want some more information. They've got other things on their plate that is taking priority. But this is where we're out of mass vaccination clinics and we're into a lot of outreach. This is from a week ago, but the state hasn't updated this chart yet. And this is just for Yellowstone County. And this is a slightly different definition. It uses vaccine uptake, meaning at least one dose. So it's not fully vaccinated. But when you look at this 70 plus population, and you see that more than 75% of those folks in that 70 plus population are vaccinated, or at least have one dose in them, I think that really correlates with the lower number of deaths. We are still seeing deaths. We are obviously still seeing hospitalizations. But the numbers are quite a bit lower as that more vulnerable population has been vaccinated. When we go back to this 20 to 59, where I told you that 75% of our cases are, you'll see that about 40% of those populations are vaccinated, or at least have one dose. Again, this is last week because the new data comes in on Tuesdays, but this is looking at our county in different age cohorts. Now, these are all in different databases, which is why the age cohorts don't exactly match up. But again, you go to 70 plus, it's 73% of those folks. Here's that working adult population. You do see 0% of the 12 to 15 population. Even though they've been able to get vaccinated for about 3 weeks now, bear in mind the definition of fully vaccinated means at least 2 weeks out from their final dose. So those initial folks are just getting their second dose now, and in 2 more weeks you'll see that number start to grow. And then the last thing I'll mention is the variance. Again, this was updated May 26th. This comes from the state. This is the most recent update, so the state hasn't updated this map. When we talk about variance and you look at these numbers, please remember that this doesn't mean that this is all the variant cases, because those variants are only tested on a random selection basis. So 16 in Yellowstone County, but identified that surely there are others who have had variant infections. But you'll see that we're at 16. Other counties, Gallatin, Lewis and Clark, Missoula, Ravalli, actually have more variant cases than we did. We're the same with Flathead and Cascade. And again, just remember, the proportions should be right because it's a random selection process. But we're definitely seeing variants. We are hearing more about some younger people being hospitalized. That is likely due to some variants as well. And then the types we've had here, we've had all 16 cases are variants of concern, which means that there's some increased risk of transmissibility, more severe disease. Most of those are the B117 variant, and we've had a couple of the California variant. So kind of our status is in terms of cases, hospitalizations, deaths, we're in a pretty steady state. I think this is kind of our baseline. We did make it through the school year. I'm happy to say, and hopefully we'll see some dropping of cases as more people are out and about. Right now, kids as young as 12 can be vaccinated, but there are clinical trials going on for younger kids. We expect that Moderna is going to get an approval for the 12 to 15-year-old age group fairly soon as well. I think that the really key thing for our community continues to be encouraging vaccination. We have done a lot of outreach. We've done more than 20 outreach clinics, and that could be schools, businesses, churches. We were at the Mustangs game on Saturday. We have about 35 that are on the books for additional outreach. But the real difference is instead of doing In the early days where we were doing 800 or 900 vaccinations in a day, the outreach clinics are anywhere from 5 to, I think there was 23 at the Mustang team. So it's a much slower go. I think where we are is we're in that vaccine hesitant group. And so there's just not the high demand, but we will continue to do outreach and go to places where we can reach folks. Talked a lot with the schools about doing some more clinics at the schools. We've done several already as we get closer to return to school in the fall, and hopefully by that time we'll also be able to vaccinate some younger kids as well. We're in kind of the slow going. When you look at those curves, you see that flattening. That really drives home that the rate of vaccination is really slowing down. Right now, we're about 43% of eligible people in Yellowstone County have been vaccinated. We're just below the state. The state is about 46%, but we're a little bit lower than that. So with that, I'd be happy to answer any questions anyone might have.
Thank you, John. I'll just start with the 800-pound gorilla in the room, which is those vaccination rates. Yellowstone County is almost 10% behind the national average. You mentioned we're behind statewide average. And yet we continue to see a very low infection rate, or at least a consistent rate of infection. How much of a concern should it be that we are lagging the rest of the country? And to the extent that is a concern, what's the scientific basis for the concern, and should we be doing something about it? And by we, I mean the city of Billings.
Yeah, so we are lagging the state, and and Montana's lagging the national levels as well. If you look at the statewide map or the vaccination rates, there's kind of an east-west divide, which, by the way, you also see in Washington and you see in Oregon, where the eastern side of the state tends to be substantially behind the western side of the state. So Missoula is now pushing 60%, look at what their current number is, but they're pushing 60% to lead the state. I do think it's important that we continue to push vaccination. Even when we think about the rate that we're at a steady rate, which is good. We're not seeing surges, but if we're averaging 16 a day, and that's over a 7-day period, that's 100 a week, that's 5,200 cases a year. So it's not a tiny number of cases, even where we are. We just seem to be at our current baseline. What will drive that down is vaccination. So our foundation, the Riverstone Health Foundation, which is a separate entity from Riverstone Health that raises philanthropic funds to support the work we do, has had 2 donors come forward and offer money for incentives. And our foundation opted to do those incentives as $50 for coming through and getting vaccinated. Each time they had $20,000, so the foundation was giving the $50 for the first 400. The first time we did that, there was 570 people came through to get vaccinated, which is good. It means that was a much bigger number than we've seen. It also means that 170 people stayed and got vaccinated after the money was gone. The second time we were just under 400. I think it was 395 or something like that. So we are looking at incentives. The federal government's looking at incentives. The state's looking at incentives. It's not some or ARPA funds or however that works. That incentives seem to work. We do think that incentives would be helpful for a lot of that younger population as well. Whether those are, they've got a lot of choices. I mean, there's cash incentives, there's drawings, there's merchandise that might be appealing. Ohio is using ARPA money to do $1 million lottery. So there's a lot of options. But it does seem like as you move into that vaccine hesitant group, maybe that incentive pushes those folks off the fence in the direction of getting vaccinated.
Okay, thank you very much. Other questions for John? Any other questions for John? Councilmember Ronning and Councilmember Neese.
Thank you. John, do you see a time, any time in the near future? Oh, you can't hear.
I'm sorry, I can't hear you. Maybe someone could repeat your question.
Hold on one second. Okay, we'll try again. Can you hear me now?
Just barely.
Okay. Can you hear me now?
That's better.
Okay. Do you think there will come a time, anytime soon, where people will be able to get vaccinated through their own primary care provider? Or will it just be through public health type events and situations?
I'm sorry, somebody's talking over you. Somebody's whispering and talking over you. I couldn't hear you.
Okay, hold on.
Try it again, just to test it.
Okay, test. Can you hear me?
That's better.
Okay.
That's better.
Okay. So, do you think there will be a time coming soon where people will be able to get a vaccination from their primary care provider and not just through public health or a pharmacy?
Yes, good question, and I heard it. So yeah, that's actually starting. The primary care and pediatric practices we've had ours going for a while, and the 2 hospital practices are now beginning to do vaccinations. I will tell you that in the case of our primary care clinic, we tend to offer that vaccine to anyone who comes in who's not vaccinated. The uptake is still pretty small, but I think in the long run, that's the answer. You'll get your COVID vaccine like you get your flu vaccine or your shingles vaccine or whatever. So yeah, we're moving into that.
All right, thank you.
Thank you, Councilmember Denise.
Thank you, Mayor. John, you mentioned about some of the age population contracting the virus, and if you walk around the community or go to Walmart or some of the stores, you see probably 90% of the people are not masked, maybe 10% are masked. So if we look at the numbers of vaccination, you've got 35 to 40% are vaccinated, 60, 65 are not. What risk is the public at with the public continues to not mask at a 90% rate when we're only 40%, 35, 40% vaccinated?
Yeah, so that is the population that is really choosing to take on additional risk of becoming ill. As you know, it's the legislature changed things, and it's much more difficult and to put out any sort of requirements for masking or things like that. And there is no requirement at this point within the state for people to wear masks. I think the point that people need to remember is, I've told you all for months and months and months that COVID-19 has been just a big risk management undertaking. So when we would look at restrictions that impact economics or the people's ability to get together, as opposed to the risk of disease. In an environment where vaccines are widely available and restrictions are extremely difficult in the current legal environment, those risk management decisions are now getting made by individuals. And so the people who are choosing to not get vaccinated and not mask are creating risk for themselves, as well as people around them, the risk of spreading disease.
Okay, thank you, Councilmember Ewalt.
Thank you, Mayor. John, I was looking at your map, and Yellowstone County, Billings in particular, is the big commerce trade area for the whole area. And we've got 16 that look like on the numbers, and there was 2 in Bighorn County and 1 in Stillwater County, and the rest of the counties surrounding us had 0. But yet they all come here. So in your contract tracing, is there just a certain segment that involves this 16? Or when these people come here, how come they're not getting COVID and taking it back to their counties?
Well, so the determination of where those cases land is based on the person's residence. So even if a person comes to Yellowstone County, gets diagnosed, but they live in, say, Stillwater County, those are Stillwater County cases. Some of it has to do, I believe, with the interest of people and people getting tested, the ease of testing. It's a little more difficult in those smaller counties where they have fewer places. So, it's hard to say if maybe they're we are a more compressed population because we are a greater population center, and we know that population compression is what allows the virus to spread more easily. I think one of the things that I always find interesting is we are typically below our 15% of cases. You'd really expect us to be a little higher because we're at a much higher level of compression than other communities. So I think that's a positive factor that we've seen. But in terms of why we don't see bigger numbers on the active cases in the surrounding counties, there's not a lot of people, so not a lot of cases. And I just remind everyone that when we can compare ourselves, say, to Bighorn County, it's no slight against Bighorn County, it's the numbers. Yellowstone County is about 12 times the size in terms of population of Bighorn County. So if there are 2 cases in Bighorn County, that's the equivalent of 24 cases in Yellowstone County. So it's pretty small numbers in those other counties.
Okay, thank you very much. I think we can call that a wrap, but thank you, John. Appreciate your efforts, and we'll continue to knock on wood and keep the numbers down and keep the vaccinations up. So appreciate your efforts. Let us know how we can help.
Thank you.
Okay, thank you, John. We do have an opportunity for public comment on item number 1, and after each one of the items on our agenda. So we'll open it up for public comment. If you're here at the library, we'll start in person and then move to anybody who is online on Zoom. If you're online on Zoom, you'll need to use your raise hand feature at the bottom of your screen on Zoom. If you hover down there, you'll get a little yellow hand. Click on that, and that way Denise Bowman knows that you would like to be unmuted. So at this time, is there anybody in the library who would like to comment on item number 1? If so, please come to the podium. Not seeing anybody. So Denise, do we have anybody on Zoom who has raised their hand to comment on item number 1?
No, Mayor, we have no attendees tonight.
Okay, thank you very much. Then we will close public comment on item number 1 and move on to item number 2. Mike Iacona is our presenter, but the way of introduction, Chris, you want to kick that one off?
Thanks, Mayor and Council. So I want to go back a little bit to, if you remember being in this room, it was January 16th of 2020. About half of the council was days on the job, and we were presenting the public safety levy and having public dialogue about work that had been done for the better part of the previous year as to how we were going to tackle what was clearly some unfortunate trends related to crime in our community. So we presented, and if you go back to those presentations, there were key strategies laid out by the police department on how they were going to tackle crime, violent crime, property crime, how we were going to deal with challenges in our downtown, how we were going to improve traffic safety, et cetera. In the fire department, we were talking about Station 8 and increases in service delivery there, and so on and so forth, from prosecution, court, and code enforcement. Then, 30 days later, between 30 and 60 days later, we saw we saw the most severe pandemic, I guess, since the previous century. And all of that was, we kind of called time out on it, decided, I think rather wisely, the council, that we couldn't outright stop, but we shifted pretty significantly to a repeal and replace levy that we took to the voters last September, and we succeeded in that. And I won't repeat all that. All of you lived it and you understand it quite intimately. But the other thing I want to, kind of tee this discussion up for is we really did deliberately try to take advantage of that year of space, and it allowed us to hire the Center for Public Safety Management to come in and do a full in-depth analysis of our police department and its service delivery, and the fire department and its service delivery. So here tonight, we're in the second one of those. You'd heard the police side of it several months back. Tonight, we're going to talk about the fire side, and though we're not here tonight to talk about this year's public safety levy, I suspect we'll steer into that, in and out of that from time to time. The point I want to make is our ask, or our recommendations to the council and to the community on how to tackle and improve the safety of our community have absolutely been adjusted by these recommendations, much of which you're going to talk about tonight. So that time, I think, was well spent. That investment was well spent. And then last but not least, we had also done the survey, the National Police Services Survey. And though that really focused on police services, I suspect had there been a National Fire Services Survey, we would have heard a similar outcome there of strong support for our fire department. So with that, tonight we're here to talk about and understand from the Center for Public Safety Management, what did they see, what did they observe, what are their recommendations? And I'm going to turn it over to Kevin, who's really led these couple of projects internally for us, who's going to do introductions of the team. So.
Thanks, Mayor and Council. Yes, we've been working with Center for Public Safety Management for several months, both on the police side and the fire side. And I just wanted to kind of put a little tight disclaimer out there. The Chief Brash would have been here this evening too, but he is out with bronchitis. He cannot even speak at this point, so I talked to him via text message earlier in the day, and he has the utmost confidence in the two that are sitting here on the fire side here, so I just wanted to make kind of that clear. It's my privilege to introduce Tom Mazurek. He's with the Center for Public Safety Management. He is the director. He has overseen our police and fire side report here. He's kind of unique career history. He's worked as a police officer, fire chief, public safety manager, city manager, so he's seen it from all sides. Police jokes and gets some fire jokes. Police ones are always so much better, but all that, and he's only 29 years old. So,
Thank you.
So it's my pleasure to introduce Tom.
I guess it won't be just getting your COVID shot that you get a bonus after this meeting. Mr. Mayor, members of council, it is a pleasure actually to see you. This is the first council meeting since, I believe, February that we've been able to actually do in person and see faces. I can't tell you how nice it is to actually see people and be able to interact after almost a year of doing this at home and by Zoom and learning that this means you're muted and all the different things. But I want to express our appreciation for your team that have been excellent to work with. I mean, a lot of times the success we have in preparing a report and presenting it is dependent on what your team can provide and how quickly. We ask a lot of them. We ask a lot of information. Our data team is getting a lot of information from dispatch and the fire department and police department, and all of our experts and many of them that have been working behind the scenes for the last year too, because they've all had to work remotely, which was kind of interesting doing that for the past year. But we were able to put together, I think, an excellent report. And I want to congratulate the new chief. I'm not sure if it's congratulations having sat in his seat. Sometimes I always thought maybe I should have stayed in that seat. But I do congratulate him. And I'm going to introduce Mike Iacona, who has been the lead on this project.
Okay. Very good.
Looks good.
Thank you. And as Tom said, it really is a pleasure to be in public. And, you got an excellent report on your COVID cases, but, there's a sense in the air that things are getting better, and there's nothing that matches that. Now, if we could just get rid of Zoom, we'd really be there. But I want to first thank the team because, as Tom said, these projects go nowhere unless you get full cooperation And, with Kevin as the lead and Chief Rash, he really had a steady hand and really, bought into the process. And one of the things that we noticed right off the bat was the caliber of people who work for this organization. Chief Hoppo, Chief Valdez are just, the tip of the iceberg. You really have a quality organization. And what we're saying today, and if you go home with anything, is that you've got a great fire department. And what we're making suggestions on is to move that bar higher. Doesn't mean that it's a substandard. Far from that. It's an excellent organization. This is minor tweaking to improve the process and help you manage an expanding workload. Because let's face it, this town is growing. The area is more complex, as the COVID situation points out. You had a problem today, with a water issue. These things come up. It's exponential the way problems follow growth. But you've got the tools to do it, and we're glad to help. We're going to go through a number of things tonight. We'll talk a little bit about our methodology, some of our initial observations, the findings and recommendations of the study, and then we did an additional piece on your extended response times to deal with the new fire station issue, and then we'll open it up to questions. In terms of our project methodology, we did an evaluation of your organizational study, your organization. We looked at your deployment practices. We looked at the entire organization. We did a number of on-site meetings, and then we followed up with an in-depth workload analysis that really dissected what's going on in this community. And then we did follow-up interactions with key staff members to make sure that what we were seeing was correct, why certain anomalies showed up, to just fine-tune the process and create that improved understanding. As I said earlier, it's an excellent organization. There's dedicated personnel, and the leadership really showed their skill set in terms of their cooperation and their ability to put their finger on issues as we elevated them. They know what's going on here. It's not a secret. The organization is adequately staffed. There are sufficient resources, and the workload is manageable. Manageable means there's some tweaking that needs to take place, and that's part of the evolution that as an area grows, you've got to do things a little differently. It's a different environment out there today than there was 20 years ago. The type of services that are being provided, it's changing, and it's becoming more and more every year. You have an excellent maintenance and replacement program. The facilities, the equipment, a fire truck today, new fire truck with equipment and everything is $800,000. A ladder truck is about $1.4 million. And these things wear out. So if you're not prepared to replace them when the time comes, you're behind the 8 ball. But your system is on top of it. There needs to be some improvements in the call screening process. That's key. That's the dispatch center. And what we're talking about today is smart dispatching. That is, you dissect the call and then you send resources on the basis of that need. If you're sending 5 units to a false alarm, you're wasting a lot of resources and you're taxing what resources you do have. So the focus today is to really key in on what's important and send those resources appropriately, not only in volume, but how they respond. The second leading cause of death in the fire service are crashes in response to incidents. You've had some in the past. Okay, so what we're saying is, if that's a minor call, don't turn on the lights and sirens. go slow. Your system is doing that. They're scaling down their responses, and I'll talk about that later on because it really sent a red flag up for us in doing our analysis. There's some need for improvement with the ambulance service, direct unit-to-unit communication. The same frequency needs to be, because that's the workload in this system. And your emergency management coordination. Today, you had an emergency management event, a water event that incorporated a number of players that you really need to drill and work on that process so that when the time comes, it hits the ground running. Your ambulance service, the arrangement with that ambulance service is by ordinance. Typically, we see contractual arrangements that set standards for service delivery, a time, certain types of reporting. It's a more viable mechanism in terms of changing it, altering it, adjusting it over time, that an ordinance is more cumbersome to operate with. So we recommend that you move to a contract agreement versus an ordinance. Performance measures. That's how you can tell on a regular basis the outcomes of service delivery. It's more than response time. It has to do with training. It has to do with accidents. It has to do with fire loss. There's a number of ways that you can measure service delivery, and these give you a pulse of, are your goals being achieved? So there's a whole series of performance measures that are recommended that we think should be implemented in your system. Audit of the payroll system. There's a lot of money that goes into the fire department, and this is beyond salaries. There's a lot of additional payments, whether it's overtime, acting pay, special pays, when people change positions, all of those have a price tag attached to it, and it makes sense. Any business would look at how they're spending the money. The fire department is the same way. You're spending money, you want to make sure that it's being done accurately and there's not gaps in the system. Employee performance appraisals. This is how you tell your employees that they're doing a good job, they're doing what they're supposed to. It's constant feedback between the supervisor and the employee. There's a lacking there that we think can be improved. And a safety and avoidance program. If people are getting hurt because their face shield is not down and they're having eye problems, you build it into your training that the first thing you do is you put down your face shield, or you're not wearing gloves. There's any number of reasons why people get hurt on the job, but an analysis of them and following the trends and then taking remedial action is the key to reduce those injuries. They have dollar costs associated with them. There are injuries to your employees. There's lost time. Very important. In terms of deployment, again, adjusting your response. If it's a minor call, go slow. Many times you don't even have to go. The ambulance can handle the call. So you can reduce your upshoot in call activity by turning it over to the ambulance company. You're scaling down your responses, but you're always running on the clock, so to speak. You're measuring that response time, even though you're purposely scaling down the calls. It's not unusual when you dissect the call activity to see upwards to 80% of the actual call activity is minor or non-emergent. I'm going to repeat that. Up to 80%. 16,000 calls. Do the math. That's a lot of calls that you don't have to run hot on. Okay. We spoke about the common radio frequency. A new thing is mobile integrated healthcare. That's that MIH, community paramedicine. This is, again, a way that they're dealing with the call volume in a smarter way. They're assisting patients at their homes so that they don't have to go to the hospital. And they're taking them to alternative locations. If they need to go to some type of abuse center, mental health, or some type of social service, they could take them there rather than to the hospital, because the hospital is getting log jammed the same way your systems are, and it's costing a lot of money to have these people filter through the emergency departments. So this mobile integrated healthcare channels these calls to a system that's more manageable, and many times it's a dedicated force. It's a service that maybe is operational, 6-7 hours a day during business hours when those social service entities are available, so they can channel them to those locations rather than into the emergency 911 system. Training. Expanded certification and college education for your leadership. These people are the ones that are making the decisions on the street. Give them the tools, give them the skills that are essential in today's environment. You operate on a seniority-based promotional system. We say go to a performance-based promotional system, merit. Skills test and written tests for your fire training. You do it for the EMS. On the fire, it's usually like a pass-fail, or you keep doing it until you get it right. We're saying test. Use this as part of the performance review process. It shows not only what the employee is doing, it's also showing the effectiveness of your training, your instruction. So put some testing, put assessments as part of that fire training. Annual physical fitness. Make sure that the men and women of your fire department are able to do the work. I mean, it's tough work. I spent 38 years in the fire service, and it's grueling. And you have to be tip-top shape to do it. We're saying make sure your people are in tip-top shape, and assess that on an annual basis. Same thing with medical evaluations. There are standards with regard to what blood pressure is. Do you have any cardiac issues? There's any number of screening processes that are recommended in the standards that every firefighter should go through while they're on the job. You're not doing that. That's important. Also, as part of your initial fire training, Firefighter 1 and Firefighter 2 are the building blocks for firefighter training. We're saying get those two curriculums done while the employee is in probation, while they're in that training phase that you're determining if they're going to fit into your system. So do those trainings as part of the probationary process. Now it takes upwards to 3 years to complete that process. In prevention, we recommend a fire risk assessment at your critical occupancies. This is just a look into those environments, whether it's an oil facility or some type of processing. Understand what it is, set tactics up in advance, see if there's any problems with storage or materials, and do that assessment for your key properties. We also think that seasonal fuel crews for wildfire, grass fires, could be helpful. Many times, these crews are self-sustaining because they are put on assignment in outside the area and you receive funding. Fuel crews can be seasonal, they're during that fire period, and they could be loaned out or hired out to recoup that cost. Integrated risk management plan. This is looking at your fires, where they are, who they're involving, when they're happening, are they seasonal, and then drill down in your prevention efforts on those populations and those times of the year, whether it's heating, fire in wood stoves or fireplaces, drill down on what's causing the fire in the effort to reduce the incidence of fires. And cost recovery for fire prevention. This is expanding the cost or the fees associated with inspections, plan review, permitting. You're getting 1 out of 6 positions funded through the permit fee. That should be much higher. Many agencies are looking at 100% cost recovery, and the industry likes it because it's tied to a standard. You say, you pay us 20% more, and we'll turn around a permit in 24 hours. Contractors love that. They're working on the clock. So before they, close up the walls, they want to have that electrical and plumbing inspection done so that they can move on to the next process, because time is money. I left my water back here. Okay. As part of our analysis, we were asked to look at the call activity as it relates to your facilities, your fire stations, and their locations. And in 2017, you had an analysis done that identified future service needs. Now, the key in that analysis was that it told you where those facilities are likely to be needed, but it said specifically, we can't tell you when. That when is a product of when those calls occur, and you start seeing these extended response times, and then you evaluate where are they occurring, and then that gives you guidance as to the future fire station location. So we were asked to evaluate that process. The study identified 3 different deployment options. Okay, the first one was 1 additional station in the Heights area. That's Hilltop and Topaz. You know that better than I do. But I had trouble remembering Heights versus the actual location. They also provided another scenario which had 2 new stations. And that was again in the Heights, and then an area north of Hesper on the west side of town. And then they also had a 9-station model, which was a combination of the 2 new fire stations, the relocation of 4 stations, and the maintenance of 3 of the existing stations. And it's not uncommon to relocate fire stations. Many times you do that because the population center shifts, and mostly because these facilities become outdated, beaten up. I mean, it's tough to run a fire station 24/7 with a bunch of burly people that, run into the walls and break things we started building fire stations more like prisons because they're tough on them. Let's face it, it is. But it's not uncommon to relocate these facilities. But anyway, they came up with 3 models. But the key here was they weren't sure when. So we looked at extended response times. We said, okay, where are the extended response time coming? And we established the criteria for what was an extended response time as calls that take over 10 minutes to process. It takes you more than 10 minutes once you call to get there. And the 10-minute was based primarily on a 90% factor. The standard says that your response time should be achieved 90% of the time. And in our analysis, that 10% of the calls are generally greater than 10 minutes. So it's a good threshold to look at, what volume of call activities are extended. Well, we found that there is roughly 1,500 calls in your system, and the system, measured about 11,000 calls, because there's over 4,000 calls were canceled en route. They never really got there. You have 16,000 calls canceled en route, some errant numbers, but we based it on about 11,000 that we had the data on. So of those 11,000, 1,500 were extended. What was interesting was that of that 1,500, roughly 80%, 1,200, were within the normal travel distance of your existing stations. So the first flag went up. These calls, these extended calls are not happening in these remote areas. These are happening in the backyard of the existing station. So that was the first red flag. Now we did find that there was roughly 300 calls, roughly 3% of your total were beyond 2.5 miles. So we said, okay, that's a fair amount. Let's see where they are. Of those 298 calls, the breakout was pretty similar to your overall population. About 70% EMS, 30% fire. And now these are fire related, like a false alarm is fire related. If somebody says, I smell smoke, or I smell gas, that goes into that number. It's not actual fires, it's fire related. There were only 8 calls with extended response times that were structure fires. I want to repeat that. 8 of your 1,500 calls were structure fires. That was another flag that went up. Now, there's a point here that, as I said, 10 minutes or greater, but only in the city, not in the BUFSA, okay? Because we're looking at the city response times as the driver for this analysis, not the extended distances in the areas outside the city. Just to show you some of the response time data for all your calls, and this is that 90 percentile. What that means is that it looks at all of the calls and it finds out where 90% is. And the 10% are the errant ones, or those that are allowable. The system is built on a system that you want to get to 90% of your calls within your recommended time frame. And they accept that 10% is going to happen. Now, of those extended response time calls, we saw some anomalies. The dispatch time was noticeably higher, and the travel time was exceptionally high. So we started saying, what's causing this? And the standard there is what we call NFPA 1710. It's a fire standard that recommends what your response time should be. So that's just there to provide a comparison. Okay, these are your extended response times. These are the 1,500 calls that took greater than 10 minutes to respond. Now, that doesn't tell you a whole lot, except that it's not in one place. It's every place. And it's hard to show even concentrations. You know, there is in the downtown area, there's a little bit on the west side, but generally, these extended response times are happening everywhere. So, one fire station in the Heights or in the Weston area is not going to deal with that issue. You know? So what is going to deal with that issue? What you paid us for. These are the calls that are outside 2.5 miles. So there you start to see where those calls are that your existing stations can't get to. But this is only 300 calls. This is not a lot. You know, we try and develop a standard that if you build a fire station, you don't want them sitting there all the time. You want to have some workload. And a good rule of thumb is 3 calls per day. 3 calls per day is roughly about 1,000 calls a year, which is a low amount. It's not a heavy workload. But this wouldn't generate, if you put a fire station in any particular place, it's not going to capture, all of those calls. These are your 8 fire calls with the extended response times. Structure fire calls. And ironically, there was only one structure fire with an extended response time that resulted in what we qualify as a high fire loss. High fire loss is $25,000 or more, and that's a combination of contents and structure or building loss. And that's the national average. A structure fire in the U.S., the average fire loss is $25,000. So you had one call that had an extended response time that had more than $25,000 in damage. And when we looked at that call, the travel time was less than 4 minutes. All right? The dispatch and turnout time was over 7 minutes. So it just passed the 10-minute threshold, but the majority of that time was not in their travel. It was in something else. So why are you having extended response times? Well, according to our analysis, there's a number of senior living facilities, in fact 4, that are generating 100 of the 300 extended, or 100 of the 1,500 extended response times. And when you see where they are, the light goes off. There's a high number of calls where the primary unit was out of position. And that can be a number of reasons. One, they're on a call, what we call a simultaneous call. There's 2 calls at the same time, and a more distant station has to come in and handle that call, and you have an extended response time. They could be out of position because of training, maintenance, meetings. There's any number of reasons, but they're not ready to go when the call comes in. There were calls, 300 or so, that they were beyond that 2.5 miles, and those resulted in extended response time. But then there were longer than expected dispatch times, turnout times, and travel times. Dispatch time is the time that it takes when the dispatch center picks up the phone to when they hand it off and say, respond engine 1. That's dispatch time. Turnout time is the time at the station when the guys and girls get the beep, they get ready, they find out where they're going. If it's a fire call, they put on their protective equipment. If it's an EMS call, they get on the vehicle and respond. That's turnout time. Travel time is when they leave the station to when they arrive. And total time is that combined accumulation. Those are the 4 notable senior facilities. Affinity, Aspen View, Mission Ridge, Morning Star. 100 of the extended response times came from those facilities. But if you look at the footnote, there were 369 calls at those facilities. So 269 were not extended. Same locations, they were not extended. So you could ask, well, maybe they were out of position and something had to cover. Well, then we looked at the call type and we evaluated what types of calls are resulting in extended response time. And this is the key of our whole analysis. For the more critical calls, difficulty breathing, motor vehicle accidents, structure fires, the percentage of extended response time real low, below the 10% number. For those calls that are generally non-emergent, not critical, your overdose, psychiatric, hazard, public service, false alarm, higher percentages of extended response time. Why is that happening? Yes, sir.
Because you don't drive as fast when you're going through those.
They're purposely slowing down their response, which is good. We want them to do that, but you're still counting it in your response time totals. So if it's a non-emergent call, throw it out. Don't count it. You know, you shouldn't be measuring your response time threshold for slower responses. It's a very simple fix. I think if you get rid of those calls that are non-emergent and remove them from your calculations, your number of extended response time is going to drop markedly. So we came up with a 7-point plan on how you could do it. All right, there are calls where the units are overloaded. And we recommend that you put in 2-person peak period roving units to handle this overload. And they're primarily in the downtown area. There's just a lot of calls. I mean, Engine 1 is responding to over 3,000 calls a year. That's a lot. You know, we usually say about 25 to 3,000 is a heavy workload. That unit's responding to over 3,000. So putting another unit in there that moves around, covers when they're gone, goes to other areas would help a lot. Identify minor non-emergent call types and exclude them from your response time calculation. All it takes is a little box that says non-emergent, and then you don't count it when you start measuring response time activities. Work with your senior living facility staff. Teach them how to report an incident. It's non-emergent. We don't need the units to run lights and sirens. In fact, on many of those calls, we just need an ambulance response. It's an interfacility transfer. We're taking them from our place, you know, over to some evaluation center, or they're going to get a stint. They're going to do, you know, certain things that are not emergent. And the ambulance can handle that. Number 4, 5, and 6 are very similar. But the key here is that you review and monitor all of those activities. The dispatch turnout time, the unit turnout time, and the travel times. Establish standards and review these on a monthly basis, but not only review them, identify where they're occurring directly. If it's station 2 on the B shift, show what their turnout time is. Show what station 6 turnout time is. Put it on a list once a month. And I guarantee you, the people at the top are going to walk with their chest puffed out because they're number 1. The people on the bottom are not going to be on the bottom twice. They're going to purposely get back on track just by monitoring and checking against the standard. We think that if you put all of these in place, that you'll have a 50% reduction in the number of extended response times. And we recommend that you do a pilot program. Put these pieces in effect, and then after 6 months or 9 months, you know, whatever you determine is the right time to do it, you know, evaluate if it is working. See if, you know, something else doesn't jump at you. But we think that if you take those steps, you'll get that number to less than 10% of your call activity. Those are the 4 assisted living facilities. You can see the stars there, right in that western area that was generating those extended response times. And then station 1, that surrounding area there. So if you do deploy, this can help guide where those resources could possibly go. In conclusion, excellent organization, one of the best I've been involved in, and it goes from the booter. The booter is the new guy to the chief. I mean, it's a quality organization. Many of the recommendations that we put into the study, your system was already evaluating them and developing methodologies to put them in place, so they weren't surprises. There's a significant workload, and it's going to increase. I mean, people learn how to use 911. It's the best deal in town. You pick up, you hit 3 numbers, you got somebody in your door in 5 minutes, and it doesn't cost a penny. So they're using it for everything. You wouldn't believe what they're using it for. Alternative deployment strategies, that's your roving unit, adjusting how you respond to different calls. That needs to take place. You'll find that most of your calls are non-emergent. I'd venture to say you're in that 70% range. One system that we evaluated, they gave their officers discretion on how they respond. If they were there 2 hours ago, they say, okay, this is Jimmy again, let's slow it down. But with that officer discretion and using the dispatch notes, which you do, and you give your officers discretion here, but you're still counting it. But this one system, they reduced their emergency responses to 15% of the total. 85% were determined to be non-emergent that didn't require lights and siren response. Performance standards, establish them, measure them, and you'll find it'll go a long way in rectifying the system.
Thank you, Mike. Excellent report. Not only important recommendations, but understandable. Appreciate your detail. Before we jump into questions for you, though, I believe that our Assistant Chief Valdez has some comments, and then we'll open it up for questions by council. Chief?
Thank you, Mayor, Council. The staff and I, we've had an opportunity to review this report prepared by the Center for Public Safety Management. I feel that it contains many recommendations that are applicable to our system. And sometimes it is good to seek counsel from a third-party organization to give us an outside looking in perspective. And such is the case with this particular report. With that said, an area that as an organization we'd like to focus on is our service delivery model. And what that would look like for us is basically a 3-pronged approach. We'd first like to address priority dispatching. And that should help to alleviate some of those low acuity type calls. The second piece of that would be to pursue a contract with an EMS provider that is willing to handle those low acuity calls. And then the high acuity calls in conjunction with us. And then the third piece of that, we'd like to implement a medical response team type of program as suggested in the report. So the first two can be established in a relatively short period with a very minimal impact to our taxpayers. And then the third piece of that is a much bigger program to put together, labor intensive to gather all the information and try to implement a plan, and that will require resources. In the meantime, we do not believe that we should lose sight of continually trying to analyze strategic placement of additional fire stations. That is the end-all be-all, if you will. That is the ultimate. That can never be replaced. So keeping the eye on the ball, but in the meantime, we'll try to implement some of these programs here to alleviate the stress on our system. Thank you.
Thank you, Chief. Chief, we'll jump into questions. I'll just start with you just to clarify those 3 items: prioritizing dispatching, contract with an ambulance provider, and implementing the 2-person EMS response teams. Just to clarify, those I'm assuming, since there's 30 some odd recommendations and that's only 3, you're not saying that you disagree or reject the others? This
No.
is just prioritization, top the iceberg? Is that the deal?
That is correct. So with the other recommendations, there to some level have been addressed. Like I said, all applicable to what we do, or most are applicable to our system being addressed. But this is kind of what we're focusing on to help us, like I said, to take the stress off of our system, wear and tear, and quite frankly, mental health. Having so many responses. So.
Okay, thank you very much. That counts. I'm going to turn to our city administrator, and then we'll jump into questions. I see Councilmember Purington and Brown's hands up. Chris?
So Mayor, we've identified what we assume really are kind of 5 buckets of where we suspect most of the dialogue is going to be in the policy area, not to limit it at all, because at the end we want to make sure we hit all of your questions. But just to kind of tee it up, we assume you're going to want to spend some time, have questions about the whole peak period deployment. As an underlying, part of this analysis is, or outcomes is this recognition that the deployment models need to change with the changing times and the changing demand on services, and you see that throughout this report. The second kind of bucket is this whole area of the medical response teams. And as the chief mentioned, that really is squarely a policy issue, because it will take more resources to do that. But that is, frankly, the overwhelming majority of the resource recommendation we made tied to the public safety levy, is the implementation of those teams. Third, chief also mentioned, is that ambulance service contract. It's easy here in Montana to assume kind of that's AMR, but AMR is not the only service provider, and we shouldn't conclude that they would be the contracted service provider. But we talked throughout the report about the value there. Fourth, dispatch, and then 5, I'm assuming because so much time has been talked about Station 8 over the last few years, there's some dialogue you want to have or questions there. And both Tom and Mike, as with the police report, these guys are fantastic to work with beyond these discussions with you, but this is the night they're in the room. I mean, after tonight, it's going to be a rare case that we have Tom and Mike here to answer questions kind of face to face. So I really encourage you to walk out of here tonight feeling like all of your questions that you had specifically of the consultant team and us, but particularly the consultant team, you've got answers to, because all the other conversations over the next many weeks and months are going to be amongst the administration, the staff teams, and yourself. So again, not to limit us to this area, but I assumed it might be helpful to kind of work in some categories as you work through your questions. But that's totally up to the mayor and the council as to how you want to proceed.
Okay, great. Thank you, Chris. I just note that overlaps very well with the chief's priorities, with the possible addition of the peak period deployment. Now our personnel are pretty well evenly distributed across the 24-hour period, so the recommendation does call for changing that to beef up during peak periods, which the EMS 2-man teams would do, or 2-person teams would do. So great, thank you for that clarification. With that, then we'll jump to questions. And Councilmember Purington and Brown. Councilmember Purington?
Thank you. So I kind of heard that different than the mayor presented it, with your 3-prong approach was with the priority dispatch. And then you said the 2-person EMS team, which would be contracted, which would maybe take the place of an AMR.
No, the 2-person teams would not be contracted. They'd work for us.
Okay, all right. So that's with the city.
Correct.
And then you're talking the medical response team, which would be mobile crisis units, whatever you want to call it, something that it's integrated with other agencies throughout Billings.
Absolutely. And so right now, this is so fresh that we haven't had an opportunity. It's in its infancy. So brainstorming many ideas. It's been tossed around that possibly two-person teams to handle those low acuity type calls or whatever we assign them to do. And then maybe possibly a third team that could handle the community type paramedicine as to be proactive in the community versus reactive.
So just to follow up, Mr. Mayor. So I guess this would go to, I'm sorry, is it mine? The gentleman.
Mike
Thank
has
you.
the beer.
Sorry.
Keep it straight that way.
I was more intent on what you were saying than what your name was, so I apologize. So whenever you made the comment, and I had seen it in the documentation, that Station 1, which is the downtown station, that they have the most calls. Are you referring or basing that on Affinity, the senior living? Or is it, why are they getting more calls based on the map of where incidents were?
It's just the concentration of generators, call generators.
Okay.
You know, you have a high concentration of calls in this downtown area because of any host of factors, businesses, people moving out. They just generate a high volume of calls in this particular area.
Perfect, thank you.
Thank you very much. Councilmember Brown?
Thank you, Mayor. Just a couple, I guess. One is, I love the contract agreement with the ambulance service, whether it's AMR or anybody else. My question, though, is if we're going to be looking at a contract to beef up some of those services that I truly feel we fall short a bit on, why do we need to add all these extra services to the fire department, which sounds like another ambulance service that we're starting to build here? I'm not sure that I necessarily agree with a contract and the city as well doing that. And I think Pepper started talking a little bit about the two-man teams. We're not talking one two-man team. We're talking 2 or 3 that would use those smaller vehicles that have just sat there and gained about 5,000 miles.
Yeah, that's correct. So the reason why we'd have a contract with a private service is because they're in the transport business where we're not. But we still would like to, regardless of the acuity level of the call, we still need to feel like we need to respond rapidly, and that these teams would be able to take care of that. Like I said, infancy. The idea is hopefully to have paramedics upon these, can stabilize any situation, and could be pretty versatile. Could do a lot of things other than just, being able to transport. Could be diverted to many different types of calls for us. So.
And one more question, Mayor. I promise one more.
That's okay.
Now, these two-man teams, these would be additional hires, correct?
That is correct.
And then we're talking about a 6-month trial, and if they don't work, those guys are gone, so they're not contracted, but they are hired at a 6-month kind of probationary period, I guess, or?
Sure. So, I don't think we'd do a 6-month trial. You're probably looking at more of a year to 18 months to get good data from that. So, if it wasn't looking good, maybe attrition. I really don't know. Like I said, this is really fresh.
Okay. Thank you, guys.
Thank you. Other questions? Councilmember Ewald?
I think.
I'm sorry, Councilmember Brown?
Chris was going to talk.
Oh, Chris wanted to comment on that. Go ahead.
I'm sorry, I think we just want to add a little bit more information to Councilmember Brown's question. So the report actually recommends that your most efficient way to tackle the additional hours of coverage is through what would require as an amendment to the labor contract, or changes to the labor contract for hours worked. So recognize at a broad scale, most Americans, right, under federal law are allowed to work 40-hour work weeks for overtime. But because of schedules in the work of firefighting and the law allows for much higher, north of 50. I get mixed up. It's 53 or 50. So 53-hour work weeks, you can contractually agree to inside of a straight time environment before overtime. So basically, we're not going to be able to conclude that in the next week before we hopefully discuss this public safety issue. The issue from a policy perspective is, do you agree to put more resources into providing a service like this? Whether we do that through more hours with the staff we have, or we do it from adding more bodies to the outfit is yet to be determined between, frankly, management and the bargaining unit. Both require more resources. One's a little more efficient than the other, but there's got to be labor buy-in to that. So just want to make sure it's not an absolute. You got to bring people in from the outside, but that is the only way if you don't adjust the current work schedule on the fire side.
Thanks, Chris.
Okay, thank you very much. Just while we're on it, what's the time period, the probationary period in our collective bargaining agreement? I assume there is one.
It's 6 months.
It's 6 months, okay. Councilmember Ronning had her hand up, and Councilmember Neese, I believe. Or I'm sorry, Councilmember Ewald first, Ewald, Ronning, Neese.
You first.
Oh, okay. I got a question, but I got a comment on what City Administrator Dr. Kulski just said. And if we're running these people specifically under medical, I don't think they would probably qualify for the 53-hour firefighter deal. I'm not sure, but I would look into that. Because they won't be hired as firemen, they'll be hired as medical personnel. So that's kind of a touchy area. I'd check into that. But my question I got is for Mike. One of I think it was the number 2 thing you hit tonight, and that was go to test-based and education-based promotion rather than seniority. Now, you spent 38 years on the fire department, right?
Yes, sir.
Okay, so if you got this big structure fire coming down, and you got this captain that's got a lot of whiskers, and you got this other captain that's got 15 fire science degrees of all kinds taped to his arm and everything, but he's never been in a structure fire, what are you going to go in with?
Well, that's a hypothetical situation, and what we're saying is that there are objective testing processes that you could determine the skill level. You know, simulations where you put people through an actual scenario and you ask them how will they act, and you evaluate that. You test them on that, and you know, I'm not saying that they come in green. I mean, the fire service requires you to go through probation. Then it requires you a certain time and grade before you qualify for the first level of promotion, which is usually the driver operator. Then once you qualify in that realm, then you test and are typically eligible for a captain or an officer's position. And then at a certain level in that capacity, then you're eligible for a chief officer promotion. So there's still a time and grade component in addition to educational requirements. These people have to learn building construction. They have to learn how to operate computers. They have to learn how to manage people, to assign workloads. There's a lot of skills that you don't necessarily get because you've been on the job for a certain period of time. It's a trained and learned skill that needs to be developed.
So a hybrid combination would really be a good way to.
Sure. The way you have it
The way you put it up there, it's get rid of seniority, and there's a lot of whiskers that make a big difference on leadership.
No, there's definitely a time and grade component that should be a qualifier to sit for promotion. But once you have the whiskers and, you know, the bold new hotshot, let them compete fairly. And then through an objective process, determine who's best for the entire environment. Because it's not just the fire scenario, they're going through EMS calls more so than they are fire crews. And they're dealing with, you know, irate people. I mean, there's interpersonal skills. it's not an easy job what these guys and girls do. I mean, they're dealing with the whole spectrum of society. And, you know, many times it's a life and death situation. Children are the worst ones to deal with because they can't tell you what's hurt, you know? So these people have to be skilled.
Okay, thank you. And I guess that means that you can wear an oxygen mask with whiskers. I wasn't sure about
They
that.
changed the way they do it now.
Oh, okay.
It's positive pressure so that it can work with whiskers.
Okay, that's great. We don't want to discriminate against whisker firefighters.
And Mayor, if I could interrupt, and she may not have whiskers.
Yeah, that's right.
So, there
Good
are
point.
women in the fire service, and they may not have whiskers.
Councilman Ronnie, you're up on the next.
Although I will tell you that as age approaches, that might not. Trust me. There's some of those that can show up. So I have 4 issues, and Councilmember Brown and Councilmember Ewald hit on a couple of them and clarified some of those. One being earlier in a city council meeting, I had asked if staffing was going to be still, additional staffing for the 2 EMS units was still going to be considered. When you read through the study, and incidentally, this report, like the police report, is so well done. So thank you. Very, very well written. Very easy to understand and comprehend. So especially for those of us that are not experts in fire or in police or something like that. So very well done. Thank you. But so kind of going back to what Chris was saying, however, in the report brings out the negotiation with the Kelly days, and that adjustment possibly creating the staffing time for these 2 EMS units. So that was a little bit different from what we had heard earlier. So personally, I am glad to hear that the additional staffing is still what's being considered. I think that's really critical. But could you touch, so one of my questions is, could you touch on the recommendation that you have for renegotiating the Kelly days? Because one of the things that was odd for me to see, but interesting, is there is a comment in the study that says adjusting the Kelly days to one 24-hour shift, 24 hours off, another 24-hour shift, 24 hours off, versus what it is right now, 24-hour shift, 48 hours off. The comment said that adjusting it to the 24-hour shift on, 24 hours off, 24 on, 24 hours off, if I understood correctly, is less fatiguing. Did I understand that correctly?
And correct me if I'm wrong, my recollection of your system is that they're always working 24 on and 48 off. Mm-hmm. However, they go through 7 iterations of that schedule. So it's like 21 days. And then they receive 2 24-hour shifts off, virtually the Kelly days. So there's 2 Kelly days out of 9 days that would normally be assigned. So what we said was, if you could negotiate it, reduce that in half so that there's 1 Kelly day per every 9 cycles. And that would generate, it would translate to, I think, a 50-hour work week. So you would get 4 hours of additional work per week that would, over time, generate roughly 72 hours of additional capacity in your system.
Okay. So the comment that was made, though, is that that would be less fatiguing, which was really interesting to me. Because, I mean, I'm a former flight attendant. We worked, non-union, worked very, very long shifts. And even if you're working not a 24-hour shift, but like a 17-hour shift, and then you have just 1 day off after that, that starts to really become fatiguing on your body.
Yeah, we don't propose that there be any change in that 24 on, 48
Okay.
off. We're just saying that when those 2 Kelly days come at the end of the 7-day cycle, that you just do a 24, 48 again. So you have 1 additional work day in your 28-day cycle, so 29. I'm not sure how many day cycles.
Okay.
What that would equate to would, like I said, one on, 2 off. So 1 24-hour shift, 48 hours off. We do that 7 times consecutively, then we generally get an 8-day break. This would move down to a 5-day break. You would take
gotcha,
away
okay.
one of those cycles, so it wouldn't be going to a 24 on, 24 off.
Okay, gotcha.
You would just lessen that 8-day break down to a 5-day break.
Okay.
That's what the
Okay,
impact.
that makes sense to me now, and that makes sense to me. And then in regard to the medical response teams, I guess this is my comment to Chris and to Chief Valdez, is that my encouragement would be to talk with and get engaged as quickly as possible with the Yellowstone Substance Abuse Connect Coalition, because as you know, Chris, they're looking at funding those mobile crisis units. And so there's a possibility that there could be funding in place to help with this if we shift from a mobile crisis unit attitude and mentality to a medical response team. Just wanted to share that, put that out there. And then in regard to the senior living facilities, one of the things that came to my mind when I was reading through the report and then in your presentation is that, for lack of better words, and certainly don't mean this to sound offensive to those senior living facilities, but just from a financial standpoint, they kind of seem to be repeat offenders. And is there a recommendation that you would have that we look at somehow coming up with a service fee for these senior living facilities that are, for lack of better words, repeat offenders? Because the reality is those senior living facilities, they should really be providing medical resources to their residents, but it seems like some of them are relying upon the fire department a little bit too much.
They do rely heavily on the fire department. And I think, though, that they're partners in the process because they're fulfilling a very important function in the community. However, there's a way to interact, there's a way to partner to find the best of both worlds. And we recommend that effort be done first. I've had specific experience in that regard. And it takes time, and it also takes a renewal process because, like many businesses, getting the workers, your employees, is a revolving door if you can get them. So they're battling issues too in keeping their floors staffed and having sufficient personnel. But in a give and take, open discussion, finding a solution that works for both, we think you can make some progress.
Super. Thank you so much.
Thank you. Councilmember Neese?
Thank you, Mayor. Mike, if you don't mind, I'm actually, that was similar to a question what Councilman Browning had regarding the senior living facilities, because as you showed them on the map, there's multiple around the whole city, but it seems to be these only 4 that were targeted. And that's where my question was, did any of these others have responses? And was there somehow a higher proportion to these? And I agree with Penny that there needs to be something done with this. And some of those, I believe, are nonprofit organizations that pay no city taxes or little, if any. And so we're fully funding that type of service. So I am concerned. How deep did you look into the fact that, well, it's just these 4? How frequent were these others actually?
You're absolutely right. There are others. And all of the facilities should be talked to about proper requesting of services. It just so happened that those 4 facilities were in that corridor that was beyond the 2.5-mile zone. So that's why they jumped out, because we just saw the same address. So So we said, what the heck is that? And then we looked it up and found out that they were all for nursing homes. And, these facilities require a lot of service because, people there are at the final stages and they require assistance regularly. So that's just part of the workload. But it could be improved. It's that smart management of your workload that requires, some steps.
Okay, go ahead, Councilmember Nace.
Yeah, I will not promise that this is my last question. But I do have a question for you, Mike, again. You mentioned during your presentation about possibly only sending the ambulance to respond. And I'd like to hear Chief Valdez's response, because I know we talked privately a little bit about that, and it seems to me like the city would not do that because they're afraid of the liability issues involved in that. So maybe between your response and can we do that, and what's that risk to us? And then Chief's, is that something we can implement in doing that? Because that will reduce the amount of equipment going out on calls. So, to you, Mike.
It's being done regularly across the nation. In many areas, the ambulance is the EMS provider. You're fortunate in this system. You have what they call a two-tiered system, which the fire department responds in tandem with the ambulance service, and then when the ambulance transports and leaves the area, the fire unit is there to handle the next call. So it gives you that redundancy. But there are many systems where the ambulance is the primary provider. So it's not uncommon to see an ambulance-only response.
And I apologize for jumping in, but on that point, Mike, how does that work how does that translate to the user of the service and the cost to them? If our crews respond and they provide service, there's no cost. And if they don't get if ours do, right? If they don't want to be transported, if they do want to be transported, it's pretty well an automatic $1,500, $2,000 bill. What if the ambulance only responds? Is there much more likelihood of transport because there's a profit or compensation motivation to do the transport? Or does that person still have the ability to receive services essentially for free? I guess it depends on our contract with them, but is it a situation where they would insist on being paid because they're not going to work for free?
Only if your contract has a response and no transport provision to it. But patients still have the ability to refuse transport. You can't take someone against their will into a service and charge them for it. Now, many agencies, they have what's called a first responder fee. And that's a fee that the fire department receives through the billing process from the ambulance service for that first response type care. California is notorious for that. And it's a lot of dollars, that's generated from this first responder fee. But there's a number of iterations that you could utilize in this process. But to your question specifically, there would not be a change in the rate that the ambulance service will charge because insurance, and particularly Medicare, is very specific as to what the criteria are for payment. You have to, cross the T and dot the I in order to get the payment. Because if the service did not warrant a certain level of care, it's like your insurance when, I just had a crown and, the insurance doesn't cover this aspect of the crown. It's the same thing with the ambulance services. If they don't meet the criteria for payment, insurance won't pay.
Okay.
Mayor.
Councilmember Neese. And Councilmember Boyette.
I actually want to hear back from Chief Valdez on the simple question about being able to implement that with the current system.
So could you repeat that for me?
Regarding they had mentioned that maybe we just send an ambulance only to a response, and I think you and I talked about that. You said, well, liability issues, we just can't do that. Is that something that you now, after hearing and reading the CMS, this report, is that something that you can implement through the 911 centers where we only send an ambulance and not send, the police and fire and ladder truck, whatever may be that.
Sure. So you're talking about the full gamut then? So from a low acuity type of call to a high acuity. So basically a stub toe versus a full-blown arrest. Is that what you're talking about, sending ambulance only? Is that your question?
I would not send ambulance only to a high acuity call, but yeah.
Okay, so, and that's what we had discussed, and I think that was the liability piece of it is, obviously we're here to serve the community, so the system that we're looking at would be a hybrid system, if you will, where the ambulance only would handle in a priority type system. There's Alpha, Bravo, Charlie, Delta, Echo. Alpha and Bravo are your low acuity type calls. Those are the ones that, as the fire chief of this community, I'd feel comfortable doing an ambulance only. But as you start getting into the Charlies and higher, it's proven that some of those calls are manpower intensive and need more help. Thus, an engine company responding with, or an MRT responding with an ambulance company.
Mayor's quick follow-up on that then.
Sure.
So regarding the 911 center, because we heard about that in the police report as well, as there was a lot of calls that maybe could have been rerouted or routed differently. With the 911 center now, are you currently doing these Alpha Bravo type calls? And so this is going to be a recommended change to where we now can send ambulance only if these are Alpha Bravo type calls.
That is correct.
Okay, thank you.
Thank you very much. Councilmember Boyette.
Well, being a citizen that's really never used the services, I'll tell you, I'd want the fire department there first before the ambulance, okay? First of all. So my question is, when I talked to Chief Rash, he said there's many times with the fire department would actually beat the ambulance there and save a life. So was there any coordination between the call time for the ambulance to get there versus the fire department to get there? Because there's only like one ambulance on the west end, but there's more fire trucks. That ambulance could be on a service call and not even be available. So I think it's important to understand the relation between those two organizations. One, we pay for direct service. I want him to show up at my house if I call him. The ambulance, it may or may not show up because I don't know anything about them. So that would be my question. How do you work the two together?
Yeah, and typically the fire department does respond and arrive first in more cases than not, because there's more fire units dispersed throughout the city than there are ambulances. So they will arrive first. But there are situations where the ambulance arrives first. And there are situations where the ambulance cancels the fire department before they arrive because they get there and it's a minor scenario that they can handle and they just take the transport. So there's the more critical scenarios where fire department personnel join the ambulance team to manage the patients. It might be multiple patients from a car accident where you got two people in a particular ambulance and you need more hands working on the multiple patients. So these decisions are handled, in the field by your personnel, and that cooperativeness delivers the service. But yeah, there's any number of scenarios where the fire department arrives first, initiates care, and the ambulance comes, finalizes the treatment, and then packages for transport. Lots of times, as the chief said, there's lifting issues, there's coming downstairs that you need multiple bodies to carry. You have a 400-pound person on the second floor, and two people aren't going to cut it. You need a lot of people to get them down the stairs.
to follow up, Mayor.
Please.
So really what it comes down to is education and training for the 911 operators, in a sense, then to say who's going to go where next.
Exactly. And they could do it.
Are there objective standards, national standards for making that determination?
That's what the Alpha Bravo Charlie MPDS, Medical Priority Dispatching System. It's a universal process that, and it's a logarithm where they say, you know, what is the patient doing? And if the patient is choking, you know, respond X, Y, and Z. You know, if they're complaining because they've had a stomach ache for 3 days, then make another series of inquiries to see what type of distress. And then eventually you get to the point where it says, send this or send that, send this one fast and this one slow. I mean, it breaks it down too. It's not only all or nothing, it deviates.
Okay, thank you very much. Councilmember Shaw and Joy?
Thank you. I have.
Oh, I'm sorry. Did I miss somebody?
Well, Matt wanted to say something.
Gee, you're not my screen. Sorry. I've become a Zoom addict, so this in-person thing is a new challenge for me.
Councilperson Dees, Councilperson Boyette, one thing that we've got to remember here is that the recommendations in here also, you know, lie heavily upon that contract for services with the ambulance. That's what guarantees us that ambulance to be there. Right now, we do not have that guarantee. We have a pretty loose ordinance that the ambulance services operate under. We wouldn't feel comfortable, at least I wouldn't feel comfortable, and I think we've discussed as a whole, you know, we need to clean that piece up and assure that if it's going to be an ambulance-only response, that unit is available to respond. You know, we want to assure the community that we have a solid system in place, you know, before we start using. I'm not going to speak for Derek on the Alpha Bravo Charlie Echo responses. You know, that all makes sense, but the first piece that's got to make sense is if we're going to only send an ambulance, that ambulance is available. And that's what a contract does for us.
Okay, thank you very much. Back to Council Members Shaw and Joy.
Thank you. So Chief Valdez, I have a quick clarification for you. Tell me if this is wrong, but this is my understanding of a medical response team would be EMS, emergency, they would have a certain level of training. Paramedicine is not, I'm looking it up as I do, it's more community prevention. It's not the emergency side, is that right? And then a mobile crisis unit, which is outside obviously of the fire department, would maybe be even a different level of training or maybe mental health as has been talked about. Is that right?
Sure. If you want to boil it down to it's very basics. Think of the community paramedicine vehicle as being one of proactive, where the MRTs would be one of reactive. And that's part of the focus that we'd like to switch to as we transition into this new era, is trying to be more proactive, so to help with maybe cutting back on some of our increased call volume.
And I like the model. I like it. I just wanted to be clear because there's a lot of terms being thrown around. And then I have a question for Mike. Can you please talk about Fire Station 8? This is a big decision the council has to make soon in terms of, are we going to be asking voters for resources for that even down the road? If so, how many years? I would just like to hear your opinion from having been in many communities. At what point do we, as the policymakers, need to really pull the trigger on that, knowing it's going to take a couple of years to really get in place?
The bottom line on Station 8 is that if you put a station either, you know, in the Heights area or in that western corridor, you're not going to get the lion's share of the calls that are resulting in extended response time. So if you want to deal with the volume of extended response time, try these other methods first. And then if you're still seeing a concentration of calls that, the fire stations don't necessarily have to equally distribute their service area. if you know one service area has a lot of calls, you may extend the service area of an adjacent station to pick up those calls to balance it off. So you could work and navigate that, because you don't want a fire station where they're not handling, 1 or 2 calls a day. That would be a waste of taxpayer money. So if you're looking at reducing the number of extended response times, we think the pilot program will get you there, whereas if you build a new fire station, you're still going to have to deal with this. It's not necessarily going to solve your problem.
Okay, thank you. Councilmember Joy?
Thank you. Mayor and Council, I think my question is for Chief Valdez. I wanted to know a little bit more. You pointed out the 3 areas that you wanted to concentrate in terms of delivering services. I wanted to ask about the cost recovery for the building inspection. Where does that fall within recommended, and where does that fall within a set of priorities, or what are you thinking on that? Thank you.
Chief Hopple was actually in the Bureau and probably can.
Thank you. Thank you.
Councilperson, I can't specifically go into, right now we do some cost recovery that basically pays for one position within the Bureau. I know that Fire Marshal Speeney has continually gone down that avenue to get more cost recovery when it comes to fees, so I know he is in a lot of support for that. He's been met with resistance. I can't specifically speak on behalf of him what that resistance is in some areas, but I know that he is in full support of trying to get more cost recovery. I believe there's also an area that it can only pay for so many positions. It can't pay for all of the positions, but definitely in support of it and looking into it and where we can recover more of those fees. But right now, the fire protection engineer portion that is outsourced, fees are collected there, and that position basically pays for the Andy, correct me if I'm wrong.
Mayor and Council, what I would add to that is, I think the two questions have to be answered simultaneously. Is the council willing to adjust the rate structure to cover those costs, and then adding the personnel is not a problem? What I don't want to do, what we've been non-committal to doing, is adding the full-time personnel, not having the rate structure adjustment to cover it, and then it costing us more in the long run. And then also, frankly, knowing that Chief Rash was retiring, knowing that we were going to get this report, the request has been in there the last 2 fiscal years to move more to the model of internal versus contracted service. And my sensitivity about that is, it really is the twofold. One, making sure the rates cover the cost and that our personnel can perform the work. Because as is the case, the contractors want performance. They're frankly, my experience, they're less concerned about the cost and far more concerned about the responsiveness and the reliability that they get that. So we have to do both at the same time so that they're not further frustrated and upset as contractors that, oh great, you brought it in-house, but now it takes 2 or 3 times as long to get the response. We need to be able to perform on the timeliness and make sure you guys are comfortable from the policy side that the rate structure is going to cover it, or we just use more reserve to cover an operational cost.
Okay, thank you, Chris. Council, I just want to point out we're now at the hour and a half that we kind of allocated for this item, and our normal break time. I guess what I would suggest is that we go ahead and take a break because we still need public comment on this. I suspect there's some additional questions. There also may be some comment or discussion that staff wants to have. We won't be able to go on all night about it, even though we could go on all night. But in particular, if there's direction or things that impact our public safety mill levy approval, anything that's critical to our budget, things that are time sensitive, we really want to try to reach some resolution on those. But since it is after 7:30 now, why don't we go ahead and take a break? It's 7:34. We'll try to come back no later than 7:40, which would be about 6 minutes. Again, wrap up with some questions and public comment and discussion. Thank you. it that way. Okay, so we left off. We're still in the kind of the question stages. Tom, you had your hand up earlier. I think you wanted to comment about the issue of a new contract with whatever ambulance provider we might have and the significance of that. So, to you, Tom.
It came up in a couple different questions, and that was one area that we felt was significant because you don't have that quality oversight. We're working on a department right now, with a department right now, similar to yours. It serves several communities, and what they've done on their bid is put it out to bid, and part of the requirement is they'll have certain response times that they will have to have an ambulance there within 12 minutes or 20 minutes, and if not, they pay a fee back to the city, $40,000. I mean, it's a significant penalty that encourages them, obviously, for compliance. You don't have any ability, so it really falls back on the fire department. They really are that circuit breaker in your system, where with the transport, because the transport agency is able to bill, your fire department can't bill. And so this one particular community and a neighboring community, that's the city of San Diego, they just bid theirs out, had two major providers that competed. They actually paid the city $7 million for their first responder fees, that they reimbursed that. And so it gives you the ability then for cost recovery, because the ambulance can bill for those services, and Medicaid, Medicare, and because of COVID now, we've seen a complete change that non-transports are even covered as a transport, because a lot of people don't want to go to the hospital. They get to homes of patients, and they say, can you just help me out, check me out? I'm maybe having blood pressure problems, or I'm feeling chest pains. They do an evaluation, and they're like, I don't want to go to the hospital. But under the new CMS rules, it allows the ambulance provider, not your fire department, they can't bill, but the ambulance provider can bill Medicaid, Medicare, and a lot of the providers now as if it was a transport, even though they didn't transport. And one of the caveats that we looked at is that as you put out these rapid response vehicles, or whatever we come up with the acronym, we were talking about that today, they may end up taking a lot of those, and you have no opportunity for reimbursement. But under your current contract, if the ambulance were dispatched, they could still collect. And so that's why we felt that contract basis was very important, because that puts you in the driver's seat of setting those standards and policies and overseeing, not just on response time, but how quick can they, do they administer aspirin on a heart patient within a certain period of time? What's their STEMI? What's their innovation, protocols? How often can they start an IV? It gives you the ability then to see how are they performing. Where right now, you're watching over these folks, but you really have no control over the bigger picture, which is the transport piece. Once they package them, it's out of your hands completely then. And so we felt that was an important piece to raise, and it kind of answers several of your questions in the back. But we've seen, especially with the COVID response, a complete different evaluation of, do we really even need to transport a lot of the people that are going to the hospital, or can they log in on Zoom? I hate to say Zoom, but the ambulance gets there, or your paramedics, and they walk through the patient. They're talking to a doctor in the emergency room. The doctor says, you know what, you don't need to come in here. It's bronchitis or it's a cold. I'll give a prescription. They actually issue it over the computer, and that patient never has to go to the hospital. And the other thing that we've seen nationwide is there's an avoidance in a lot of cases of people wanting to go to the hospital. And so when these folks are getting there, what might have been a minor call before, a pain in the arm, they're having a full-blown heart attack. That pretty much every agency that we've looked at during COVID, a lot of people are waiting because I don't want to go to the hospital. I don't want to risk getting COVID. I don't want people in my house, so I'll wait. And now they're having a major stroke. In fact, know somebody very close to me that did that. He waited because he didn't want to go to the hospital, and then had a major stroke, and it was too late by the time he did get there. And so we've seen a whole kind of different picture emerging out of the COVID. In some ways, much better, because we can deliver better service, especially when they're going out, because they know the patient, they know the area and everything else. But it's having that ability to evaluate and to kind of reward good performance and not get stuck with just any service. I think the other day we were talking, they had it was an hour and some time that they were sitting on the patient waiting for the transport. That's extremely high. We just don't see that. And if we do, we'd say that needs to be addressed real quickly, because now you're taking an engine company out of service, which then impacts your whole system because you don't have extras, kind of floating around. So when that company is out, that service area is uncovered. So that's why we felt those were important. I just thought I'd elaborate a little bit more.
Thank you very much for that clarification. So I have some additional questions, and we'll open up for public comment and come back for general discussion by the council. Councilmember Ewald?
Thank you, Mayor. Mike, I guess this is probably for you too again. You do studies on fire departments all over the country. How many fire departments charge like a system development fee? If that's what's driving having to build more stations is people get spread out, and so you put a charge on the building permit to help cover the cost of putting a station out there. And I know that's just the station cost and the staff and the engine, the first engine, but at least it takes care of some of it. And then the other thing is, I know on some calls you go out 4 or 5 times a day on one person. And are there fire departments recouping like after 5 calls a month? Do they charge for any extra calls after that on the same person, or is that not permissible, or how's that work?
Let me answer the first question with regard to some type of impact fee, because that's, I think what you're getting at is that and it's a formula that is usually authorized by a state legislature. So there's a formula that looks at the cost of your operation and looks primarily at your infrastructure, all of your stations, all of your rolling stock, and comes up with a dollar amount, and then looks at the population that owns that dollar amount and creates like a pro rata share. So it may come out that the net worth of your infrastructure is $600 per person, and then that is the basis for your impact fee. Now, that impact fee, though, can only be charged to new growth. All right, it can't be a replacement cost, and many times impact fees have a spending limit. You have to spend it in a 6, 7, 8 year period. Otherwise, it's returned. I had a situation one time where I pitched a fit because they were charging me an impact fee for a fire station. And I said, wait a second, why are you charging me an impact fee? The reason we're getting this money so I could build fire stations. But then I realized it rechanneled and started the clock over again for that money. So I didn't have 7 years. I started from scratch again. But generally it's new growth, and it's on the basis of, you could, like, say, for example, if you were going to put a mobile response team in a station to handle that extra growth, you could pay for that capital aspect of the mobile response team, that additional unit. You can't replace that engine's there, but you can add because it's caused by growth.
So just to clarify, Councilmember Ewald asked whether you've seen those, and it sounds like the answer is yes.
Oh, yes. There's consultants that will help you decide what your fee should be, but I'm not sure if Montana has a restriction on impact fees.
We do have a statute, Councilmember Chris Kukulski, you want to comment?
So absolutely, they're allowable in the state of Montana. Very similar to what Mike described. You can't, though. They can only cover for additional capacity needs. So I think of it of taking a photograph kind of time today. Let's say we were down in facilities, you couldn't start charging all the new people for that deficiency. but they calculate what's the impact, say the $600 for each new house, different rate based on businesses, and that money can be set aside to deal with the capital needs to increase the capacity of your system. But in order to be eligible, you got to follow state law. State law essentially requires a third-party analysis, and there are several companies around the country that do those impact fee studies to tell you what the fee needs to be in Billings, Montana to meet the future need.
So, Mike, the second question then was charging the individuals when they...
The frequent flyers.
The frequent flyers, yes.
Typically, no. You don't do it on the medical side. The only experience I have with the frequent flyers are with false alarms. There's a number of entities that have a false alarm fee, and these fees typically kick in after a certain number, like your third or your fourth, and then it's graduated so that if you have a fourth, a fifth, and a sixth, the sixth may be twice as much money as the fourth. And it's usually in a cycle. We typically don't recommend them because they're more work than the money they generate. You know, if you have a false alarm fee, because again, you've got to tie it to the actual cost. So if you start prorating, you know, a 20-minute call, you know, you're talking a couple of $100, and it really doesn't generate a lot over the time that it takes to implement it.
Okay, thank you very much. Other questions before we go to public comment, and then we can come back for general discussion, and if you've got additional questions. But Councilmember Trickey, are you?
Yeah, I'll ask a question. So, have you guys written a white paper, or do you have apps, or can you point us to a resource that could get our heads around the economics of medical response, emergency response? Because I'm hearing a lot of things that are kind of, you know, playing around in here that we could possibly do and stuff like that. So I'd kind of like to get my head around that issue.
Are you talking about, you know, dissecting what it would cost you to implement a medical response team in your system?
Just, you know, much broader than that, you know, so it's like, you know, you were saying, you know, like, you know, we can charge insurance, you know, some amount, you know, there's, you know, how do the EMR companies like EMR, how are they making their money, you know, I'm trying to get an idea of where we kind of sit in that whole ecosystem.
There's a number of entities that we could recommend that you evaluate their system. Like MedStar in the Dallas-Fort Worth is probably a leader in this, pre-hospital community paramedicine. In fact, they even have specialized dispatchers. And once they dissect the call, then they hand it off to a separate dispatcher who knows, you know, what are the outlets that they could send these people to and really, you know, take it the next step. Colorado Springs Fire Department, again, is a leader in this, medical response team or community paramedicine. And there's others. I could provide you the names of some of them. And, you know, many times it's getting on the phone. There's probably 5 or 6 in Montana. Red Lodge is one. Glasgow is another. Broadus is another that have implemented in their communities. So there's some that you interact with on a regular basis that you could, you know, pick their brain as to the do's and don'ts.
Thank you, Mike. One other question there, Mike or Tom. We're about to pull the trigger on the parameters for a public safety mill levy, release going out to the voters, and how much should be asked for for the fire department is a big element here. Your recommendation is pretty clear that you don't think that we need to staff a 8th fire station now, anyway. But some of these recommendations still cost money. So can you tell us the price tag that we need to be taking into account? Because once we establish that funding source, if it passes, we're going to be locked into that potentially for a number of years. I assume the answer to that is no. You can't, but I want to give you the opportunity. And in particular, if there are elements of your recommendations that you know will require significant funding, if you can give us ballparks, anything that you can help us on the cost side of this, I just want to make sure you have been asked to do what you can.
It's driven by the hours that you're going to have this system in place. So, for example, if you have, let's say for the sake of argument, 2 units, two-person units that are operational in your system, and let's say that those units are going to be operational 10 hours a day. So you're dealing with 20 hours per day at what is your hourly rate, your full burden rate for that multiplied out through the course of the year. And then the equipment is typically a lower cost. You know, if you're looking at, and the one that we used as a picture in the study is a 3/4 ton pickup truck with compartmentation. You know, state bid, those things are in the $70,000 to $80,000 range. You could get 6-7 years of full-time use, and you could prorate that out, to come up with a really good ballpark number as to what this is going to cost. But the financial wizards really need to put their fingers all over it, because they're the ones that, know all of the subtle or costs that are associated with putting people in the street. But it's really driven by hours.
Okay, thank you. Councilmember Brown and Neese?
And just to further that, you're also recommending like $3 million in building maintenance and remodel and, a few other things. So, but those are just a single one-time hard cost, add those on.
Correct. And your organization had a very detailed capital program needs that drove those numbers with, a little extra.
Thanks, Mike.
Thank you. Councilmember Neese?
Mike, if you don't mind, you showed us that map of the, I think it was 1,500 calls that were over time. If we're going to implement some of these strategies like the smart, what do you call that? Dispersing, the Alpha Bravo type system, and some of the ambulances can take some of those calls without having resources the fire department put in. And we have a contract that we actually can maybe even get them to be more responsive to those type of calls. How do you see that watch of the city with all those 1,500 calls? What would the contract be able to reduce that, or maybe just if your recommendation of just the 2 quick response units? What do you see in that reducing those response times?
I think you could reduce it to more than half of your 50.
700.
Yeah, you could get it down to 700, in that range. And I really think the majority of them will come from your removal of the non-emergent calls. We'll call it an intentional slowdown, where the crews are slowing down those calls, kick them out of the response time calculation. That'll probably take care of 25% of them, if you just stop counting them against your response time numbers.
So a quick follow-up on that, because I don't want people to think we're going to screw with the numbers.
I'm sorry?
I don't want people to think that we're going to screw with the numbers as far as saying, hey, our response times are so good now because, we're not including all these others. So how do you actually show that data where, for years we've included everything, and now you're talking about possibly excluding some of these, and suddenly our response times are going to go down? and we're saying we're excluding certain calls. Is there, to me, it seems like we're kind of fudging numbers when we do that.
The science says don't run hot on every call because you're taking risk and your outcomes are not improved by a faster response time. And that's documented.
Mike, on that issue, does the NFPA 1710 standard that identifies this 4-minute response time, does it allow us to do this, or are we going to really look bad in whoever cares about these things?
Let me ask one of the members in 1710.
The one thing that 1710 and 1720 is companion article really, companion standard really looked at, and we've argued, how do you account for those? Because on one hand, we're telling agencies, slow down. You don't need to hurry to the guy that's been sick or a woman that's been sick for 3 days, and I just suddenly called 911 because I think I need to go to the hospital. How do we account for this? And so what you do is you create a separate tracking mechanism for those non-emergent calls. And in some agencies, they establish multiple. So like they may have an urban, it's called standards of response coverage, that you have a target or you set a baseline for your urban area. And then for the suburban area, you may have a different time that it's going to take you longer to get there. You may have a third one that's in the standard, it's called rural, that it takes longer, so your surrounding area that you provide service to may have a rural standard that it takes a little bit longer to. And then it's called wildland or remote. It's kind of like same-day service in a lot of departments. So if you look at Clackamas County, for instance, Oregon, their remote it can take 4 or 5 hours to get to some of their remote around the mountain. And the standard allows for that. So it's not like you're throwing it out, you're still tracking it, but you're putting it in the right category. If you know it's a non-emergency and you know that the people shouldn't be responding emergent, then you should count that against all the other emergency calls. You're actually contaminating that evaluation by throwing those in. So it's not like you're throwing out, not like you're playing numbers. You're still going to report it. You're still going to track it. And then you can also look at what was the outcome of that. And when Councilman Sharkey remarked on white papers, Tulsa, Oklahoma probably has the most exhaustive study of that. Their medical director has looked at, I think it's 56,000 calls, or might be 156,000. We actually validated that at one point, and he wrote a white paper, and what it resulted in was that for the majority of their non-emergent calls, they said if we get there within 12 to 24 minutes, we looked at, they said, over 100,000 and 1,226 diagnostic groups, and he found it made absolutely no difference, that the outcome was exactly the same, getting there in 24 minutes and taking their time and getting there the way they should versus running every red light and putting other people at risk as well as the responder. And so they've now completely changed it, and that would be Tulsa, Oklahoma, and I think he's also the medical director for Oklahoma City, I believe is that. That he's looked at both of those, and they've expanded those time limits as a result. It's not like you're contaminating or throwing it out or messing with the numbers. The standard actually expects that kind of evaluation and that kind of accountability, that you're still keeping it in the system, but the way it should be actually tracked.
Okay, thank you. Sounds like it's allowed as long as you categorize appropriately. Council, I'd recommend that we go to public comment now, and we can come back, kind of do some sort of a wrap-up. But if you are here with us in the library and would like to comment, please come forward. We'll look to the in-person comments first and then look to Zoom. Please keep your comments to 3 minutes or less and tell us your name and address up front. So if you'd like to comment, please come to the podium. Would anybody like to come to the podium?
Go.
Sit. Yes, I would like to comment on BUFSA. I have a question. I don't know whether to address it to Mike or whether to address it to you, Mayor. We know that the city is, does a fee for the fire trucks that comes a fee for the fire trucks, to BUFSA area, like surrounding areas, Molten area. And I was just wondering if any person member of the council has challenged the county, on an increase for your, to use our fire trucks. Because I think that would be a good time, because once you do increase in their fire trucks, they're gonna think a little bit more, on hitting them in the pocketbook, about our BUFSA. And that is just my recommendation as a concerned citizen, is to increase the amount that we charge for them to use our fire truck. And that is just the same as with the conversation before, as Chief Pedro here, you don't want to be across the street from South Park and say, okay, going to have a ladder truck or way out there, says, okay, man down, who do we call now? That's expensive for that. That's all I have to say, your Mayor.
Okay, thank you. We will comment. We'll get our comment, or all the comments in, and then we can come back to that question, because there's definitely been some developments there.
Thank you.
Next.
Good evening, Mayor and Council. Tom Rupsis, 105 Legends Way. I just wanted to again echo the comments on just the outstanding nature of this report. I just found it actually just very interesting. But I loved how it put a lot of the context of the things that we think and take for granted, the things that we think we know, specifically like response time is the be all and end all of everything, and how that's actually counterproductive in a lot of cases, and we should think differently about that. The context of basic life support versus advanced life support, and where does our department fit in that? And so I think it's challenging us to think through a lot of different things. So thank you for providing that to us. I just wanted to comment on one thing, because it hasn't come up in any of your conversation. There's a section in the report that talks about interagency emergency response, intergovernmental emergency response between the county and the city and other areas in broader emergencies. And it's going to be relevant to your next two conversations tonight, your conversation on both the budget and the mill levy. So it says on page 93, they're talking about the emergency response. It says the public information process and the establishment of a viable and sufficient public call center has not been fully planned and established as a key responsibility of the emergency planning effort. There's been a lot of conversation about a public information officer, and most of the conversation that I've heard anyway has been related to almost a PR role, marketing role for the city, or even fundraising. But I haven't heard a lot of this kind of context to what a public information officer can do in terms of the integration of communication and the planning, of communication between intergovernmental agencies, between departments within the city, and then out to the public in an emergency type situation. So I just suggest that you should keep that in mind as you go through those rest of the conversations tonight. This is all tying together, and it's great information for us to have. So thank you.
Thank you. Any other public comment from here in the library? Not seeing any, so if you're online and you'd like to comment, please use your raise hand feature, a little yellow hand, click on that. That way Dennis Bowman, our city clerk, knows to unmute you. Denise, do we have anybody online who would like to comment?
No, Mayor, we have no attendees this evening.
Okay. Apologies, I'll keep asking you in case I guess somebody shows up. But until then, we don't have any other public comment here in the library, so we will close our public comment period on this item. Council, we do have to proceed, but it seems like a shame if there's further comments, questions. We're a little bit, or about a half hour beyond our allocation, but Councilmember Purington and Neese.
Just a quick question for the chief. I think this is one area that you would be familiar with in your new role. I've asked this question regarding the labor negotiations that are, I guess, in progress or getting ready to be in progress. So what is your take on changing the schedule? The people in your department, and I think that you're aware of what the negotiators are like. So that's kind of my concern, because to me, some of the recommendations do make more effective use of the current staff that you have. What is your take on what that would look like?
So, in regards to the schedule, that is one of the most cherished things, if you will, for the career. And as we progress and call volumes continue to go up, one of the things that I worry about as the fire chief is mental health. And when we add more to the work schedule, we're adding more to their plate. So I do worry about with more work hours comes more exposure. So I do worry about that, but we have many demographics on the department, and so you can ask some of our younger people who would be happy to not do anything else and solely focus on fire. You can ask some of the older people on the job that are ready to be done. They may say no. It could go anyway. So without a crystal ball, I really couldn't tell you. The general feel is it's 50-50, right down the middle.
So follow up, Mr. Mayor.
Go ahead.
So whenever you mention about mental health and dealing in a stressful occupation, and I can relate to that. I'm also seeing some of the areas in this report that shows that there's actually a better way, if you will, to do some of these things, that maybe there would be less trauma to the firefighters. And one of your prongs was your crisis unit, which I think would be highly stressful because that's what they're going to be used for.
Sure.
But you're also talking about a proactive team that would actually go out into the community, I guess, and see what needs to be done. It's not always reactive like an emergency or an AMR type situation. So one of the things that I just wanted to follow up with, you had your 3-prong setup that you were looking towards. And then, Chris, you came up with 5 buckets, and I kind of see those buckets merging with the 3 because some of them, I think, are, like an AMR contract or something like that. So, Chief, given, what you're looking to do, and knowing that there are stations that either are in disrepair or, we were talking a little bit about even a remodel or something, so you're going to have to come up with a price tag of some of the things that you want to do and what you want to do with your medical response team and the price tag on doing your priority dispatch, because that's going to take some training to do that. So have you started working in that direction of a price tag yet for some of these areas that you're talking about?
Absolutely. So the challenge with something like this is that there are so many variables to deal with. And like we were saying, that it's really up to your imagination on how you want to approach something like this. So, but I can tell you that I have started working with my staff. We're looking at a bunch of different models. We don't have any hard numbers right now. All we can do is generalize. And that's just one aspect of the 3. So I would say 2-3 months we'll probably have something hammered down in what that's going to look like. And as far as, as far as safety levy stuff that you're talking about, obviously we're going to have to move a little quicker.
Go a little quicker.
Sure, absolutely. But as far as the implementation of it, that's going to take some time.
Sure. I understand. Thank you.
You bet.
Okay, thank you. Councilor Denise had his hand up, I believe, but Chris, could you just comment before we forget on the Buff's cost increase issue that was raised by Mr. Olvestead?
We'll keep it really quick. As you're well aware, there was an adjustment last year, about 30%. We think short of an in-depth analysis of fire service delivery, it's about where it needs to be. But yeah, there was a substantial increase last year in recognition. Frankly, it's now tied directly to taxable value. So there was a lot of taxable value for property being built in the BUFSA that per capita or per property, they were paying a little less every year. Now we're recognizing and we're capturing that amount. And at this point, I think in general terms, it really is a win-win. We can, and that's where we need it to be. Because if we step away from that $1.6 million is what I think the number is in that neighborhood, $1.6 million, the good news is it opens up more capacity for us to provide services inside the city limits, but we lose $1.6 million in revenue. And remember, they're about 5% of the call demand. So they're not as significant, they're meaningful, but they're not as significant call volume, but they are a significant risk. So I think we've got that balanced fairly at this point.
Okay, thank you. Councilmember Neese, I believe you had your hand up. Is that still the case? Then Councilmember Ronning?
I did, and I'll reserve that. I'll ask my question another time, different segment.
Councilmember Ronning?
And I'll leave this to you, Mayor Cole. I'd like to ask Chief Valdez, so this may be a public safety mill levy question though too. We heard from CPMS about Fire Station 8. I'd like to hear from our fire department, and if you want this question to move to the public safety mill levy section, I'm fine with that too, to address us on Fire Station 8 as well.
So with this this program, we are essentially addressing one aspect of what we do. We do a lot of other things. We do rescues, we do hazardous materials, so on and so forth. And within the EMS portion of that, you have a high percentage that entails, extrications, other things like that, that are wrapped up into the EMS part of that. As a fire chief, I need to be looking into the future, and so staff and I are going to keep an eye on growth around the city, but I can tell you, I feel more comfortable by having brick and mortar and another big piece of iron strategically placed somewhere within the city.
Thank you.
Okay, thank you very much. Council, we've still got quite a bit of work to do tonight, so if there's nothing else, I suggest we move on to item number 3, rather. Okay, then we'll do that. On to the budget wrap-up. Tom, Mike, thank you again.
Thank you.
Everybody on your team who helped with this, I hope you'll communicate our appreciation for the job well done.
And we'll be in touch, and if you need us, I think we've given you our cards. Feel free to give us a question, send us an email. Email sometimes gets quicker to me because I've been flying. All of a sudden, everybody wants to have an in-person, but so I can sometimes get that on the plane. But,
we have no doubt that you're going to nail this.
Okay. You can run, but you can't hide, so we'll be fine.
and definitely Chris knows where we are. So. Thanks.
All right. Just sincere thanks to them. I've known Tom. It's hard to believe it has been all the way back to the Michigan days that I met Tom when he was in law enforcement as city manager there. So this is the first time we've actually gotten to work together, and I appreciate what you guys have recognized in both reports. An absolute professional job in English.
Yeah,
you can kind of understand. So thank you, Tom, to you and your team.
Thank you.
Thanks again. Okay, Andy is going to lead us through, I believe, on item number 3, our budget wrap-up.
Okay, all right. Good evening, Mayor and City Council. We moved from one easy-to-understand report to another, the budget. So tonight's presentation, I kind of look at it kind of as 2 parts. One is wrap up on what staff is recommending to council. There's a couple of things that have changed over the past month and a half. We've been making you aware of them as they go along. And then there's also an element in here that are, I would say, direct answers to questions that you guys posed over the past 6 weeks. So without further ado, we'll get started. The main goal tonight is we want to walk away with some clear direction from council as a body on what they want to see for budget adoption on June 28th. You don't have to make those decisions tonight. You're not setting budget now. But generally, I'd like to have a sense on what it is council wants to adopt, or if there are things they do or do not want in the budget. So we're not spending a lot of time debating on the 28th. But that's generally the goal for this evening. So the general fund, we'll start with that. Oh no, that's not good. So, all right, and that's it. Any questions?
The white screen up
We're
there.
going to stop sharing. Well, I'm not going to stop sharing. Let's see, escape. And great. All right, let me open it up off my desktop, or I might have Kevin save me.
Just let me know when you want me to step in there, Andrew.
Yeah, you want to take over? But good news is you do have the presentation. It was part of the memo, which doesn't help the public who didn't look at it ahead of time. Very few of them, I suppose, though.
You want me to share mine?
Oh, I've got it on my desktop for this very reason. And back almost. Share screen. Let's hope it's that one. All right, I'm not going full screen, so we're just going to go with that. All right. So the same direction. We're looking. That's the last time I showed you this slide. All right, general fund. Again, so the general fund, you've seen all the departments. I'm not going to rehash those tonight. If there's specific questions, the directors are on. We've got representatives from the TIFs here to answer specific questions. But you've seen all that. This is really overview on the few, I'd say, remaining items. As you've been notified in the past, there is a request from staff to add to the budget that you received on April 28th, 26th, a paralegal. And this is to handle public records requests, largely public records requests associated with the implementation of the body cam program. So the recommended expenditure budget for the general fund is $53,729,974. There was a request from council to discuss what a public information officer would look like from cost, how it would be funded, and what they would do. I'm going to turn it over to Chris in a second, but generally it says I'm trying to connect back to Zoom, but it's still up there. So, nope, this one's not me. All right, Kevin, take it away.
Here we go.
All right. We're just going to have a lot of next slides tonight. So generally the cost is $80,000 to $90,000, I think is what the slide says. And this would be funded partially through charges back to other departments. We do this with other administrative functions, a portion of Chris's salary, Kevin's salary, my own, the accounting software, things that the entire city uses. We do charge those back to departments. Obviously, we don't charge back to the general fund. That'd get rather circular. We don't charge to police and fire for the same reason. What you end up seeing is about a cost recovery of around 40 to 50% of that expense. It's not 100% recovered from other departments because it's utilized by the general fund, by our police and fire. But as far as the rest of it, I'll turn to Chris on that.
The piece I'll add to it, and I'll keep it brief and then be happy to answer questions you have. First of all, as I looked at several other job descriptions of positions like this, and we've got very accustomed to public information officer. I don't want to get caught up in the title and that level of detail, but I'll use a title because I think it's helped kind of descriptive, which is I see several communications coordinator. If the organization is not big enough to where it's a director level position for communications, MSUB, large universities, much larger cities, then I'm tending to see more coordinators that are responsible for developing the strategic communication plan, for working across departments to bring continuity to the communication. But the idea isn't this is the one person that you're always going to hear from. Yesterday's emergency, you're probably still going to hear from a public safety expert, not the PIO of the city or the communications coordinator. But that coordinator is absolutely engaged in that and helping the effectiveness of it, as well as where communications take place. Another concept you've brought out that I think would be an enhancement for us, and you pointed out its importance, is the idea of making sure that those partnerships that we so heavily rely on in our city, whether they're individuals or entities, get the appropriate level of communication, recognition, and appreciation for what they do in partnership with the city. I think that could greatly be enhanced, as well as communication with our task forces. Both two-way communication in our community. The part that makes me very candidly nervous that I've heard you bring up more than once is the notion that maybe this person's the grant writer. Not that they couldn't assist with communication of messaging, but I think you really are looking at two full-time jobs when you say a city grant writer and a communication specialist, whatever that area is. And that's what I would just caution us, is not to make sure we overload that position with so many expectations that someone won't succeed in that. And I think I'll leave it at that. As Andy said, we've lowered the cost overall because we've looked at both the data that's out there, and we were definitely on the high side. And about 40% of this over the long term will end up being reimbursed by those other departments, which I think will also cause some efficiencies on that side. Some of those departments are spending direct dollars on communication that will make deliberate decisions, whether they continue that or whether this person really can make that more efficient and effective. We strongly support the position. It was not there, how do I say this? But for the limitation on dollars, we were absolutely wanted. It was one of the last cuts that was made. One of the easiest ways to tackle this, if you're supportive of it, is if we get good news on our taxable value number. As it was one of the last cuts, frankly, I'd want it to be one of the last adds back in if we get good news on our taxable value information, but we don't get that until August. So happy to answer any questions to kind of the highlights, I think.
And we'll come back to that.
Sure.
Let's get the presentation and then.
Yep, sounds good.
All right, so the current use of reserves in the general fund is about 13 million, but the ongoing operating deficit that's in the current budget is 1.3 million. And as you're aware, the plan is to solve that as part of the public safety levy, because that's largely where that concentration exists. If we added the public information officer, that would increase this use of reserves slightly by $80,000 to $90,000 in the first few years, reduced by about half over time. Public safety fund, there is one requested change here. This is new to you and the council after working with the chief. Back in December, council authorized, it was a little over $1 million in additional resources for our police department. About 400,000 of that was for overtime and training. And we just did an analysis a week or two ago that it appears that there'll be about 250,000 remaining in that overtime portion that isn't going to be spent by June 30. So we're requesting that that be added to the police department's budget so they can continue that process for the remainder of the year. And so you will see a request to increase $250,000 for FY22 for the police department. And consequently, when we bring back fourth quarter budget amendments, we would reduce that FY21 budget by $250,000. So we're really just asking to move it from one year to the next. And that's the only change here for the public safety fund. So increasing the police department's budget from $26,761,000 to $27,011,000. There was a request kind of for a maybe list of what's in the budget that we are putting towards public safety that is in the FY22 budget. And these are the investments that we're recommending for FY22. It's significant capital improvements to the fire department. It includes both about $450,000 to existing stations, $1.5 million to be set aside or start working on the plan for an 8th fire station. There's $11.6 million set aside for capital improvements to develop a facility for Law and Justice Center in FY22. There's additional staffing in the legal department, partially grant funded for the domestic violence prosecution, and then the staffing the full-time code enforcement supervisor, which is something we've been trying to do for years, and felt like it's time to pull the trigger on that. And then, as you're aware, being asked to consider a public safety levy for other additional resources. And I'll remind you, those other additional resources are not currently in the budget. We can talk about that, but if we are successful at passing a levy, then we would come back to amend the budget to include those things. This portion is Park District 1. There was, I would say, need for clarity on what was in the budget, and then I think presentation on some discussion about council, or that council had on May 19th. So currently the budget for Park District 1 is built upon the assumption that the assessment amount that was charged in 21 remains the same for 22. And I mean the percentage. So in fiscal year 21, we were assessing 1.4097% of taxable value, which is $207,822,943, to generate $3 million. The budget has been built upon an assumption that, or a recommendation that 1.4097% stay the same. What we will see is we assume to see is an increase in taxable value. We're assuming a 4.5% increase. That's going to take it to $217 million. Leaving that taxable value percentage the same will generate more revenue, but it will generate more revenue, about $130,000, $135,000 more. So I think I've got some kind of infographics here. So again, a $200,000 home in 21 paid $38.06. If the home value didn't change in 22, they're going to pay the same $38.06. Next slide. Whoa. It's not advancing on my screen, so I'll look up there. This is just, I don't need that thing. All right, so the median home in 21 was not 200,000, it was 211,000. We, at that time, is $40.16. These are both the same assessment rate, 1.4097%. The median home in 22 increased, so using that same percentage, the median home would increase to $41.37 per year. Right? Increase of what is it? $1.21. There was a request from council to see what did a 3% increase look like, and so what we did is we took $3 million, increased it by 3% or $90,000. Say what percentage would we need in order? What would that assessment rate look like if we did that? So there are some assumptions here that will impact that rate, but this is. I'll back up here a little bit. So we would bring in a little less revenue than what we're. So we're assuming a 4.5% growth. So we bring in 1.5% less revenue. We'd need to reduce the PD1 budget by just under $44,000 from what's presented in the proposed budget, because the revenue coming in would be less. So we're still assuming a 4.5% growth in taxable value, but instead of seeing 4.5% growth in revenue, we would fix it at 3% growth. So that would require an assessment rate of 1.3895%. Not a lot less, but it does reduce it slightly. So next one, Kevin. So same information in 21, $200,000 home, $38.06, 1.4%. It was the assessment rate. We wanted to fix it to a $90,000 increase to cap at 3% growth. That would reduce that $200,000 home's assessment in 22 to $37.52. I should have put the math up there, but it's approximately 50 cents. So the median home value changes, we know that. So last year, this is the same slide, right? We're just changing the assessment rates to show you what it means in real dollars. The median home of $211,000 paid $40.16. If we fix the 3% growth, that would take the assessment rate to 1.3895% or $40.78. So really, I think this boils down to two options that I'd like some clarity from council on. Is, do you want to maintain existing assessment rates, which would grow as property tax value, or property tax value grows? Or do you want to set a specific growth amount for Park District 1? I think that really is what it boils down to. I've kind of identified, I think there are pros to either way here. Obviously, we'd grow as the city grows with that. So as new development occurs, it captures the demand for services for that new development as annexation and new development happens, if we stay with the fixed percentage. If council decides to go with a known increase on an annual basis, whatever that may be, if you want to tie it to construction cost index, which is how we do our street assessments, or if you wanted to tie it to something else. Either way, we would know what that percentage is, ideally, back in February or March. So when we bring the proposed budget to you, there's no mystery on what that assessment revenue is going to be. We know it's going to be $3,090,000, so we can build a budget for that. So there's some value in the predictability there. So I think we do, that's one key thing I'd like to walk away with tonight. These next few slides are really, I don't have a lot to add in the way of content for you. These were included in your slideshow. They were specific requests from council members, so I've added them, I've given them to you. There are representatives from the TIF districts they're here as well, if there are specific questions. But this is the breakdown of the downtown tax increment, back over, Kevin, of the downtown tax increment charge that we pay to the DBP to manage the TIF district applications, downtown revolving loan, the services that they do. It's $279,441, but broken down in a lot more detail, which I think was the specific request from council. Next, the focus was on downtown, but we obviously gave you the same information for east, and then which is 139,946, and south. The only thing I'll really have to add here, east and south, they have one FTE that they're paying with their services, and I believe downtown has 2.7 full-time equivalents that they're using to manage and provide services downtown. Next, some historical budget information was requested. Last time we presented the change in the city as a whole, what the growth had been. There was a request for some more refined information, specifically the general fund. So this is the chart version of it. It was 27% increase since 2012, or approximately 3% per year. I think the next slide just has it broken down by department, by amount. These are actual expenses in the general fund. Very legible, so there's, again, as I stated earlier, I think there's a lot here, but I don't have a lot to add to it. It was just more to give you exactly what some of you had requested to help your decision making. This slide here is the FY21 budget compared to the FY22 budget by department. Shows the dollar change by department and the percentage change by department. I think if there are specific questions about it, we certainly will go into it, but this is very generalized, very high level. You look at the facilities at 756% increase, and you think, what is going on there? Well, we're building a law and justice center in the budget, so it's going way up. But I think that was one of the specific requests, so I wanted to make sure you had it as well. So overall, we presented a budget in April that totaled the bottom number $463,995,349. Since that time, we have added a paralegal for the legal department. We are requesting to move the $250,000 from 21 to 22 for the police department to roll forward. I found a $6,000 error in the city attorney grant fund, so we can reduce that one by $6,000. I didn't tell Gina this now. And then in the summary pages, again, there's a request from council right before we gave you the proposed budget to increase the sidewalk construction. So that made it to the fund pages, but not to the summary pages in your proposed budget. So they are in here. That would take the total FY22 budget as proposed by staff, $464,659,349. Staffing. This slide or this chart was in the proposed budget. I've highlighted the two changes. One, paralegal, adding it there. And then the other one is the facilities maintenance person. I had neglected to include that on the list originally, the dollar amounts. We're contracting for a lot of services out at the police barn, and as Jessica presented in her presentation, the intention is to take those dollars, hire someone, and provide those services, I guess, to a greater extent than what's being done today. The dollars are in there. There's actually no new dollars. It's really just, like I said, rolling from contracted services into staffing. So that's why you don't see new dollars added to the budget, but it is not. It is being added to the list, just so you're aware. So that's total FTEs. Finally, getting close here. The charts for median home annual property tax and assessments. These are based upon a home in both years of $217,400, which is the median home today, or in today, I'll say that. Up top are the property tax mill levies. We are not recommending any increase because of our charter cap. So there will be no dollar amount change between those 2 years on a home valued at $217,000. General obligation bonds, because the value of the city is going to go up, we can levy fewer mills. We're estimating it's about $1.44 reduction per year. Then the assessment districts. You've seen requested increases for those, and Park District 1, here again, we built the budget, keeping the assessment rate at 1.4097%, $41.37, no change there. Increases in street, arterial, and storm that were presented during the Public Works budget presentation. All of this, the median home pays an annual property tax and assessment bill for the city of $799.21, or $66.60 a month. Again, that's the amount of the property tax bill that goes to the city. That wouldn't obviously be the total property tax bill, since the county, school district, and state are on there as well.
So just emphasize on that point, right? We just want to give some context. We realize half of the citizens pay less than this, half pay more. But as we think about taxes, I often think people think of what they pay the federal government, which is typically in the thousands per year, or tens of thousands in some cases for those who are very fortunate. State, what you pay in state taxes, what you're paying your local government is in the hundreds. It's not in the thousands, generally. And so, looking at that service list, I think we have a lot to be proud of what you get for your investment. I mean, you're investing, that median homeowner is investing $800 a year in their getting police, fire, parks, et cetera, et cetera, et cetera, et cetera. The public safety levy takes that up essentially $100 from 800 to 900. So just some context there. And also, I'd ask you to think about your other services you pay for. If you happen to be someone who has a cell phone, if you happen to have, television services and streaming, internet, just the other services you pay for, what are those costing you as your investment that you make, and how's the city doing in its job of taking good care of your taxpayers' dollars and investing them in services back to the citizens? And I think most people don't really think about the fact that $67 a month is what they're paying for a lot of services at their local city government level. So, go ahead.
Thanks. So that obviously was just the property tax bill. It does not include your monthly utility bills. You received pretty detailed information on water and wastewater over the past few weeks, and those rates are actually set. So this is what the average utility bill will look like the next fiscal year if council adopts a budget consistent with those rates. So it'd be $82.43 per month, up $2.38. This slide you've seen in the past. It's not necessarily, I think, the thing you make decisions based upon, but I think it gives some perspective on when we take that property tax and assessment bill and divide it by the number of residents in the city and compare ourselves on that metric to the other communities in Montana that have the same tax authority or ability that we do without the cap charter, of course. Billings falls right between Great Falls and Missoula. I guess, third on the list of 6 there, or second on the list of 6 from least to greatest. Again, we may not be giving the same services that other communities do with these dollars, but I think it's important to see that we're not the highest taxed community in the state. This slide was presented the night we gave you the budget to remind you these are important things, very big decision, a budget. I think things that will impact our budget coming forward soon, but they're not included in the FY22 budget. At the time, we didn't know anything about, or knew very little about the American Rescue Plan implementation. We have some guidance now. We will be bringing something to council shortly to start utilizing those dollars, and they will be tied with budget amendments. But you will receive, I think, a fair amount of education on that, and we'll be seeking recommendations from council on projects to go forward with. There are no long-term parks funding solutions in the budget. In March, council received information about long-term parks funding strategies and the needs in the Parks Department. But with the priority listing, the needs of the city, Chris and city staff thought the focus needs to be on public safety this year. So that's why you see some investment in public safety, as well as a request to proceed with a mill levy for additional resources. And then finally, as I stated earlier, there are no budget dollars there today. I shouldn't say no. There are no additional investments associated with the public safety levy in the budget today. So if it's successful and passes, we will bring back a budget amendment to start implementing these items in FY22, even though we won't start seeing the revenue from that levy, if successful, until 2023. But it's our belief that we could start implementing those in 22, knowing that the revenue is coming and we have significant cash on hand to begin some of those processes. Wanted to remind you, this was part of the parks funding presentation. The total needs there, I would say, that are ongoing. These are not the total needs, but the total staffing needs that were projected at that time is about $575,000. So if there was some desire to put this into the budget, figure out a way to go forward with it, that's about the dollar amount that you'd be looking at. I don't know if Chris, you have more to add there.
I'm not necessarily suggesting that we do that at this late hour, but I didn't want to lose sight of what the conversation was in March, what the conversation is tied to the budget, and what I would anticipate, frankly, as city administrator, that it would be something we would absolutely be talking about in calendar year 22, as we think about the fact that we do have to kind of walk and chew gum at the same time. Yep, we got a lot of public safety things to focus on, but we know quality of life, the amenities, our park system, our rec programs, and we saw an 80% uptick in families or individuals signing kids up for rec programs. That wasn't by accident. They're looking for their kids to be engaged in this stuff. It's good stuff. So I just really wanted to put that there so that we didn't lose sight of that context as we, hopefully in months, not years, start focusing our tackling on the capital and the operational investments in the Parks Department.
That concludes the presentation. Again, I'd like to walk away with some consensus from council as a body on what it is that they want to see, specifically with PD1, because I think while the rates, you won't set those till later in the year, they do have implications on the budgeted amount. And so we will need to make adjustments accordingly. And I think that'll be important. And then if there's anything else, the PIO, I think, is one that was been brought up. Anything else that you could envision?
Okay, Council, back to you. Councilmember Joy and then Ronnie.
Thank you, Mayor and Council. I just have one question. The supplemental budget request for $250,000 that's being rolled over, is that going to impact our use of reserves in the general fund?
Councilmember Joy, it will increase it in 22, but it will reduce it in 21. So it's really net zero, if that explains it.
Councilmember Ronnie?
Thank you. That was part of my question too, and so I have to think about that a little bit more when you just said that. Because I had a question about that $250,000 also. And part of my question was for that $250,000 to roll over, and we're going for a public safety mill levy. I'm trying to reconcile that in my mind as to the overtime and things like that. Why are we not including that in a public safety mill levy? But maybe that's a question for Chris. But, you know, it's clear that we've got these issues regarding overtime. So if we're going to roll over $250,000 this coming year, we're going to need another $250,000 for the next year and the next year and the next year. I mean, it seems like this overtime is an issue.
Councilman Ronning, the way I would look at it is you allocated $1 million of expenditure to the police department last year of cash that we had, wherever it came from. We weren't able to spend it all. Why? And particularly in that overtime area. A fair amount of overtime was added, but it didn't all get spent. It's either going to get added to the reserve, or you want to reallocate it for the same purpose in the next fiscal year. And it's not an addition that I think has to be permanent, candidly. If I thought it needed to be permanent, then yes, it should be a part of the public safety levy conversation, but really, at least what I heard the council say is with the pandemic and the huge increase in violent crime we've seen, let's use some of that money in the near term and let's see what the impact of that is. And frankly, if the chief is available, or Chief House is available, Assistant Chief House, it's made an impact, but they couldn't spend as much money as you gave them in that short a period of time, using our our police officers to cover all those extra shifts in time in that short period.
Okay, so thank you. So I guess I still kind of have to wrap my head around that a little bit because the council in 2000, I think it was maybe 19 for that budget. I mean, it was clear that there were cuts to overtime that were made by the council. And those were clear decisions that were made that the majority of council at that time said no more paying for overtime. So while I don't support that, didn't support it then, I don't support it now, I think overtime is necessary. My concern is that the council's already made a policy decision on that. It feels a little bit like we're going back on that. But I'll take your word for however you describe that it's not going to be a permanent type thing. Because I think if it's a permanent thing, then the city council needs to readdress that as a policy body. If that makes sense what I'm saying.
If I may, Mayor, I think so. I would say council made a policy decision to authorize another 1.2 million for the police department this year. We're asking that that decision just be continued, not that it go on forever. So I think there was a policy decision that was made with respect to these dollars already.
Okay, all right, that sounds good. So the other question that I had to do with that slide with the public information officer, and I just wanted to thank you for clarifying that, because when I first saw that slide, I was really like, what? That slide felt very weak to me because I don't think that you need a public information officer to write public speeches. And so some of the things that were listed on that slide don't really seem to be the types of things that the council has said they would like for a public information officer. But I really like the language you used, Chris, when you explained it as a coordinator. Maybe it's a public information coordinator. And some of the issues that Tom Rups has said, we have discussed those, that there needs to be internal coordination. So I'm glad you clarified that. And just wanted to say thank you on that, because that slide really gave me a lot of concerns. So thank you. And I also just want to say that I don't think City Council has said that they're looking for a full-time grant writer, although that would be really nice and hopefully something to be considered in the future. But I do think City Council has advised City Administration that within that coordinated position, that coordinated position would have grant writing abilities to be able to provide resources to all of the departments that have to write grants to heavily fund their programs. That's not going to go away. But I think that this position could be one that adds a great benefit to that grant writing resource for all of the departments. So just wanted to clarify that.
Okay, thank you, Councilmembers Brown, Neese.
Andy, could you, on the PD1, the slide that you have I believe those are all additional staff that they're looking for $540-some thousand, is that correct?
575, yeah, I believe that's all new staff that was part of the funding, the parks funding presentation. If I recall, it was their priority on where they needed staffing needs, but it was $575,000 for new additional staff. I think Mike is on if there's a question of probably more detail that he'd be much.
I'm wondering, obviously we do have some possibility of increasing PD1 for a short time. Whether it's going to go away in the future or not, is to be seen. We know that we can't go out for a mill levy this year in competition. So that's a big ask for new staff. And is this a year after year? Or is this just to catch up? What is this 574?
So, Mayor and Council, my recollection, if you go back, thinking back to the March presentation, much of this was about implementing the am I using the right term, comp plan for the park system. And then there were some additions in that there have been additional parks, not at the regional level, like the Centennial, but of additional lands that have come on. So this was trying to get closer to meeting the demands per the comp plan for properly maintaining and operating the park system. And no, I would not expect year over year these kind of additions, but I would expect if we're fortunate enough that the public supports a bond issue or something to build more parks, there will be, or develop out parks. Every time we develop out a park, there is some level of increase in demand for maintenance and operation of those parks.
Yeah, so this 574 though, if we dug that out somewhere, that would be a year to year, or we'd have to lay these people off.
Yeah, I'm sorry, they would continue. What I meant to say is you wouldn't be looking at these kinds of ads year over year over year. You're looking at trying to get caught up from the fact that we've not, I don't know, the staff additions on the parks maintenance side of the equation are pretty sparse over the past, many years.
Right.
So that was in that request that the council had, which is, hey, show us the full picture of what we're facing as a community relative to park investment on the capital side, as well as park operation and maintenance. This was the operation and maintenance component of what that full picture need is.
Okay, thank you guys.
Okay, Councilmember Neese.
Thank you. I had a question. Go back to what Andy was talking about, the PIO. I'm sorry, the overtime. If I remember correctly, we had actually increased staff at that time too. There was a couple of police officers, and so I don't think the overtime was needed as much. But we approved that 1.2 million, was it?
Yeah.
And so there were some specific needs that they were supposed to do within that period of time. And I'm not so sure, unless I hear from the police as far as what's been done, how successful that was, and why we need to carry that forward. I've always assumed the chief would, if he needed overtime, would come to, we probably would see a budget amendment. So for that smaller amount, I guess I would like to hear from the chief as to why it wasn't, how it wasn't almost spent to begin with. And I did have a question about,
Can we make sure, just to kind of help Deputy Chief House out a little bit, two components. There was a laundry list of kind of capital or one-time purchase items that were a part of that, $1 million, $2 million, $1 request. And then it was at 300 or 350 in overtime, 400 in overtime. This number here is just the overtime discussion. Each of those components that you approved, those dollars have been allocated and ordered and equipment, things like that, to that. We're not suggesting turnaround spending on anything other than the items you authorized.
So thank you, Chief. Chief, if you can comment then on the 250 of the 400 that went unspent.
Correct. We realize it's a one-time funding only. We don't expect anything else in the future from this. It was just that we didn't have the manpower to spend all the money at this time, so we're just asking to carry it forward throughout the rest of the year so we can spend it on overtime on the projects we're doing right now.
So the money you spent, what's been done? How does that help the public?
I'll refer to Lieutenant Lennick. He's actually one that managed the fund and did everything.
Mayor and Councilman Neese. I can speak to what we did for the overtime details in January and February. That was when I was in charge of that at the Crime Prevention Center. So I opened up some overtime details. I worked with our crime analyst to find details that would best benefit the citizens in the community in areas where we could spend time, and then also get some interest with the officers on things that they would be willing to sign up for. Because just offering, come on in and work an extra shift, I don't get anyone to sign up for that kind of stuff, right? So I got to put something that they're interested in doing. In January, we opened up the downtown patrol. So we opened up 6-hour shifts throughout the month and let the officers come in and help supplement the DBA officers and providing extra officers in the downtown district and to focus on some of our problems in that area. And the chief was pretty adamant about spending a lot of time or trying to get as much interest as possible in trying to work on that. And then we opened up like a proactive theft. We have a lot of property crime throughout the city. And so I wanted officers to go out and work in either uniform or in an unmarked car and just work proactively on recovering stolen property, locating thefts and stuff like that are going on around the city, and then making arrests or working with victims to get their property back. And then, so in the month of January itself, we generated 107 self-initiated reports, totaled out to be 8 misdemeanor arrests, 2 felony arrests, and that was I only got interest in 18 details that month, in a total of 34 different officers signing up on those and working those. So, and then February, I opened up some new details. I opened up traffic because we had some issues with some intersections in the city that have high number of crashes. I think there were 11 different intersections that we targeted, and I had officers go out and work, specifically working on red light violations and stuff like that throughout those intersections where we have a lot of crashes. I also had an issue with our domestic violence investigator being completely overloaded with trying to keep up with victims of domestic violence, and just making sure that we were providing those services to those victims, those continued services, and making sure that they were getting support from our department and we were keeping track of their cases and stuff like that. So I opened up those two details, and in that month we generated 232 self-initiated cases. So in just those 2 months that I was responsible for spending some of this money, we did a total of 47 details and did self-initiated 339 self-initiated cases. And so really, like the chief was saying, it wasn't that we didn't have things to go out and do. It was that finding the manpower to sign up for those. I had opened much more than just those details. I just didn't have officers that were willing or could sign up. And so we just ran out of time with the ability to spend the money. So, and I turned this over. So Sergeant West is now in charge of it for the last several months. And I don't have any of the data that you have his? Perfect. And I'll let the chief speak to what he's been doing over the last couple of months. So that's how we started.
Thank you. And Chief, as you go through those, it's not just helpful what was done, but what you anticipate will be done. probably a continuation of those efforts, but if you can comment on that.
So Council, in March, we went up to 322 contacts and then jumped up in April to over 445. Because warmer weather, manpower became more available with the new guys coming onto the streets and joining the ranks. We do have a detail that I really can't go into, but it's with the county attorney's office. It's something that we, a lot of thefts in the area that this will work with. It's a new idea that we have never done before, and the county attorney's office has jumped all over it and is willing to prosecute it. I think it will help with thefts from vehicles, from low-level thefts from stores, something like that.
Okay, thank you very much. Councilmember Neese, thanks for that question. Councilmember Ewald.
Thank you, Mayor. I got a question on that same thing. So what it kind of boils down to is you got officers that aren't willing to work overtime to help. Like we always hear traffic, people are driving too fast, and you can't get officers to go out and write tickets. Is that what it boils down to?
What it boils down to is we have some officers that love overtime and some that do not like working overtime. So I'm unable to force them to do this type of work.
I understand that. You can't force them to, but I mean, it's like you got a chance to make some extra money and they wouldn't even do it. You know, this is a 6-month time period to spend $400,000 in overtime. And we always hear how if we had more money, we could get more stuff done. And now we're hearing, well, we can't get more stuff done because we don't have anybody that wants to work overtime. It's kind of confusing.
I get it, Councilman. Eric, you might.
Okay, Chief, feel free to comment if you'd like, and then Councilmember Neese.
No, I get exactly where he's coming from. It's an issue that we try to deal with. We have a core, I think, of 20 officers, 15 to 20 officers that will jump in and dive into it and do overtime all the time. You have officers who have a goal of buying something, and they focus on that goal and they'll go out and do overtime or extra duty for that goal. Once they achieve that goal, then they're done doing overtime. We have a lot of officers that are getting burned out because they're doing overtime on their regular shifts. And if you're a night shifter and you're getting held over off shift at 7 a.m. and you're getting held over until 10 a.m. on a domestic or a violent crime, a shooting or homicide, they're giving that overtime up because they do not want to come back in and do it. It's a safety issue too. I get it. And they're getting burned out.
Doesn't that overtime, excuse me, Mayor, can I?
Sure, go ahead.
Doesn't that overtime, if they get held over from 7 to 10, doesn't that count on this 400,000 then?
I'm not sure how that's taken into account. I'm not sure. It's not.
It'd be part of the regular overtime budgeted annually.
Yeah. Please don't think this is the overtime budget. And the overtime budget is not the 400,000 you've allocated. That was the additional resource and detail. There's additional overtime.
400,000, sorry.
No, please.
400,000 is just for the extra duties that we're trying to get out there and curb crime and traffic.
Okay, thank you. And it's expensive overtime. We know that. Councilmember Neese? And then Councilmember Shaw.
Thank you, Mayor. And I do want to say thank you very much for your answers. And I think that what you're doing is I was wondering why the delay. You've answered it well. And I think it's because you can't just get someone out there and create programs. It takes time to do that. And these programs then take some time to implement too. So I'm fully in support of carrying on the 250,000 over after hearing from what you've done, what you're trying to do, and how it's actually implementing. And so please take it. My question is not being that you're not doing your job. Please, I understand what you're doing. I do appreciate because money wisely spent. So thank you.
Thank you very much, Councilmember Shaw.
Thank you. Can we switch topics? Andy asked us a specific question about PD1. So I feel like before it gets too late, I would like to try and answer that. You wanted an answer. Can we pull up that slide real quick? And Andy, would you just go in just briefly a little more the pros and cons of each of these?
Okay. I guess I want to read it or start by saying I think it's very wise that council moved a year ago to some inflationary increase here, right? It's not realistic to think that we can keep dollars the same anywhere for long periods of time. And we've experienced that in other areas. So I don't have a huge passion either way, but there are pros on both that I think are helpful. I kind of like keeping it at 1.4097% because it captures new growth very well. As we annex new developments, as new development happens on vacant land, those values go up and those folks start paying 1.4097% of their property value. If we fix it at 3%, those folks come in and they aren't paying 1.4%, they're paying 1.38, then that will slowly decrease over time as a percentage of the property value. I think that does very well to capture new growth, to help new growth pay for the increased services and demand that exist because of them. However, it's not incredibly predictable. Just like we don't know the general fund revenue is going to go up, or the taxable value is going to go up by 4.5%. I mean, I know it's not going to be that number. It's going to be right around there, but we don't know what it exactly will be. So there's a big benefit to going with a specific growth because we know and we can plan for that, and it's a lot. I think it's probably easier for Mike if I tell him in March, all right, 3%, this is what you get, and go ahead. But I guess that'd be the pros on either side.
Thank you. Can I have a follow-up?
Please.
I would like to make a motion to direct staff to maintain the existing assessment rate of 1.4. Personally, I like the idea of it growing as the tax base grows and everyone paying the same percentage of their cost on. And I think also when people come into the system, it's not really fair to give them a cheaper rate than what people have been paying in the past. So that would be my motion.
Okay, we have a motion. Is there a second to the motion? Councilmember Joy. So again, that doesn't implement this, but it does give direction to staff to incorporate that into the budget going forward. Discussion now on the motion. Councilmember Joy, since it's your second, the Councilmember Bernice.
Thank you, Mayor and Council. Looking more broadly at the way the city funds our services, we have a cap, a charter cap on our mill levies. Our assessment districts are very important. I would like that to continue on and not to be limited to the 3%, or fixed at 3%. I think as growth is happening, and it will continue to grow, even though it is a bit unpredictable, as you were saying. I still support this motion. I think it's the best way for us to continue to have those revenue sources without limiting at some point the point where we start to go backwards in our assessment. So I think this is just a good way to go. Thank you.
Thank you very much. Councilmember Bernice.
Yeah, I'm glad you brought this up. I was going to have more discussion at first, but when I think if we looked at what the PD1 did, this council held it for $2 million for a number of years. But I think partly if there's a lot of if you go back to the history, you'll realize understand that I think initially it was going to be a 9 or 10 year type of program, and council held it. Brown knows best; he's been on longer to know the history behind it. And then we did agree, I think, to do a 3% increase. However, last year I think we didn't do that. We just moved $1 million out of the parks budget into that. So that was a 50% increase of what the tax residents saw. And so I think the council's decision at that time was say, okay, let's do a 3% increase. I think is appropriate, and that's what I would support. But not this type of increase, because now we're going to 4.5% increase. We're already seeing a 3% increase on utilities and some of the other increases. So I know I won't support the motion. I'd rather see us have the plan, and we don't know for sure if it's going to increase 4.5%. It may only increase 3% of taxable value, or 2.9%, whatever it may be. I think to have a plan of a fixed budget amount is something that we should just fix the dollar amount, and then whatever that taxable value is, Andy will figure it out moving forward.
Thank you very much. Further discussion on the motion. Councilmember Brown?
Yeah, I'm in agreement. I mean, we just agreed to the 3% not too long ago. And I don't think I'm up to changing it again so soon. And even the $1 million that was added, I think everybody understood maybe temporary, at that point, depending on a mill levy, all of those kinds of things. Now that's obviously broadened, but I'm going to stick to the 3% as well. I mean, we just made that decision not too long ago.
Okay, further discussion? Andy, I guess I'll just ask you, remind me what the history was with the 3% number as you recall, and why 3% as opposed to, say, the construction inflation number that the streets department uses, which I think is mid-4s, and given current inflation rate would perhaps be quite a bit above that in reality. If we really were trying to tie it to inflation, it might be quite a bit more than 3%.
Mayor, City Council, my recollection on the 3%, it was during the CIP process. I think the Parks Department and Parks Board recommended that an inflationary increase occur. As you recalled, then last year, rather than doing an inflationary increase, and at that time it was 3% was the number that was thrown out, but it was just during the CIP process. There was no official action related to that. And then when we went through the budget process, the decision to move $1 million from the general fund for parks into Park District 1 for parks, we didn't bring a 3% recommendation on top of that. So I think historically, Public Works has tied to the construction cost index, and in recent history, it's been, I want to say, approximately 3%. But I think you're right that we will likely see inflationary increases greater than 3% in the future. It may be wise to tie to an index in the future, or perhaps even this year.
Okay, thank you. Further discussion before we vote on the motion? I'll just comment, boy, I can live with it either way. I just appreciate that there's some sort of an increase. I do think that's wise. I'm a little concerned if it's a flat 3% that we'll decide that doesn't make sense, and then we'll have to have this discussion every year and debate where if it's just tied to property value, that's kind of what people understand from their regular taxes. So I'm thinking that may be simpler and more understandable, but I can live with it either way. Any other discussion? If not, we'll proceed to a vote on the motion. Okay, so the motion again is to tie it to that the rate, which is 1.4%, but the assessment will go up with property value. Is the motion clear? Okay, all in favor of the motion, please raise your hand. Those voting in favor are Council Members Cole, Chiriky, Ronning, Joy, and Shaw. If voting in opposition, please raise your hand. Voting in opposition are Council Members Yakowicz, Neese, Brown. Okay, Walton.
I'll call Boyette, see what.
So we have a tie vote. Councilmember Boyette had to go home early. He had a bit of a cough. And so the motion fails because it's a tie. So further discussion, Councilmember Neese.
I suppose I'll make the motion, direct staff to keep it at a 3% increase and see if we pull anyone from the other side over. Otherwise, we'll have to call Boyette.
This is the direction I'm looking for.
I do have a coin in my pocket, if that helps anybody. And I'm afraid we won't be able to call Councilmember Boyette because I don't think our rules allow for that, I'm afraid. But we do have a motion. Is there a second to that motion?
Mayor, question.
Question before we look for the second? Councilmember Neese, go ahead.
Councilman, you all mentioned that if it doesn't pass, the original prior councils had approved a 3% increase, so would that just be the direction that the staff should take instead of making this motion?
Is there a default out there, I guess is the question. Was there some sort of official direction? Chris Kukulski, you want to comment on that?
The default, I would say, whether it was direction or not, is the budget that was presented is a fixed rate. You have every authority to change that, but that's how the budget was presented to you, was with the fixed rate.
Was with the 3%?
With 3%. No, the fixed rate of 1.4097. The other thing I would tell you is whatever you do, it can't last for more than 2 or 3 years of any level of consistency, because the future council, due to the legislature, is going to have to figure out if Park District 1 is going to keep on going or if it's going to be replaced with a levy. So it's not a sword to die on either way, whichever way you want to go, but just a reminder that whatever you do here isn't going to be long-term, but the presented budget included the fixed rate amount. You can amend that, and if you direct us tonight, knowing where you want to go, that's what we'll do. We'll bring it to you on the 28th with a change. Otherwise, it will stay the way it is in the proposed budget.
Okay, and I'll continue on.
I'm sorry, Councilmember Neese, can you clarify that?
I'll continue on with the motion I made of the 3%.
Okay, so we do have a motion. We've got a second, Councilmember Ewald. So Chris, just to clarify, if the motion fails, then it proceeds, but at our next meeting, which would be a week from today, we'll have the budget before us? No.
June 28th.
June 28th would be the appropriate time for Councilmember Boyette as our kingmaker to weigh in, I guess, at that point.
Anybody can make a motion on the 28th to amend the budget any way they want. So this would be a proposed, if you couldn't figure it out tonight, someone will make a motion that night to adjust it the way you want.
Okay, hopefully that's clear of the procedure. So discussion now on the motion. Councilmember Joy.
I would like thank you, Mayor and Council. I'd like a little bit of a clarification. I thought I heard Councilmember Neese say an increase of 3%. And what I thought we were doing is making a fixed percent 3%. I'm a little bit confused.
The increase would be 3%, and then the rate would adjust whatever is necessary to get you to the 3% increase. Does that clarify?
Yes.
Okay. And hopefully I said that correctly, Andy?
I think so.
Okay. Okay, so for any further discussion on that motion, Councilmember Ewald.
Okay, now you got me confused because we gave 3% last year and that's what it's going to stay at. That's what my second was. Is that what your motion was?
Yeah, 3%.
Okay, we're not increasing it another 3%, we're keeping the same 3%.
3% every year.
Yeah.
Every year.
But that we made, that passed last year and we're keeping it the same instead of going up to 1.4, whatever mils.
Okay, but the 3% would be a new 3% every year.
Yes. Right.
Councilmember Ewald, can you nod on that, or are you disagreeing that you get a one-time 3% increase? What we're talking about are multiple 3%.
In perpetuity. Right, Mike?
Well, until it was changed. Until the council changed, went a different direction, but yeah. For the purpose of this budget.
Yeah, I mean, you set the rate every year.
Yeah.
I mean, no matter what, the elected body sets the rate annually.
Okay, any other discussion? Is the motion clear to everybody? And if so, is there any further discussion on that motion? So the question is basically, do you want to make a shift tonight or wait until our June 28th meeting on this? Okay, if no further discussion, we'll move to a vote on Councilmember Neese's motion. Okay, all in favor of Councilmember Neese's motion, please raise your hand. Voting in favor are Council members Yakowicz, Neese, Brown, Ronning, Ewald, and Purington, which I believe we've got 6. If voting in opposition, please raise your hand. Voting in opposition, Council members Cole, Chiriki, Joy, Shaw. So the motion passes. So that's what it'll be. At least unless it gets changed on the 28th.
Until the 28th, yeah.
Public comment?
We have not had public comment on this item. That's right. But we're giving direction, and if we will get to public comment, and if you want to reconsider, we can do that. But council, it's a good point. Is there any other? I appreciate that reminder. We should move to public comment before getting into other votes, if we can. Council, any other issues you want to raise before we go to public comment? Councilmember Neese.
Yes, I have a question regarding, excuse me, the TIF financial reports. And Andy, I think we asked, and I know it's not something you can't do this year, but more standardized financial reports, I assume we'll see those probably next year, meaning line items, maybe all of them 3 columns, so they may give them to you, but you're gonna put them in nice rows of columns and make it look pretty or something. But that way we can kind of compare how each of the different districts do. But I do have a question in regard to one item. It's the total expenditures for DBP specific expenses, and it's $40,000 for business development, recruitment, and retention. I'm assuming that's for maybe personnel of some sort, but the majority of that additional budget, I'm trying to figure out why, is that additional personnel that was removed above as far as recruitment, retention? Are we talking about maybe recruiting, retention of businesses? And then how is that spent?
Great. Good evening, Mayor and Council. Thanks for letting us clarify. The partnership-specific dollar amounts, the one that you are looking at here is business development and recruitment and retention. This was part of an ordinance that was changing and updating the urban renewal plan that Council did adopt that did ask the partnership to have a focus on business development. Specifically, the urban renewal plan states that we will recruit new business and make every effort to retain existing businesses. So that is specific to bringing in new businesses to downtown and providing resources for existing businesses to either expand or retain their existing sustainable success. So that is specific to business development. It's not recruiting any new staff members or anything like that.
So, Mayor, quick follow-up on that.
Sure.
So how was that spent this last budget year?
So what you'll also see here is you do have a reserve that's being kind of carried over into this budget here because of the pandemic. Some of the travel that we were planning to do to actually go to other communities and talk to businesses to try to incentivize them to relocate to Billings or to open up an additional location in Billings, the travel was not able to happen. So that money was spent specifically through website development. So we have a very extensive website kind of collection of pages that is specific for partnership development that talks about what TIF grants are available, how do you access the revolving loan fund, how do you access existing spaces that are available for lease, how do you contact a business owner or a property owner to talk about their existing business. And so we saw great success for that. We had over 50 new businesses or new spaces become occupied over the last 18 months, and that was in part for that work that we did through website development, through printed materials that we mailed out, that we handed out, that we went to different locations in our own community and regionally that where we were able to do that. And so specifically website, printed, some actual marketing campaign ideas that we had, some time and resources spent towards social media campaign in that. But you will see that little reserve that is carried over. That we will hope that we can continue this next year. We have a plan to work again with Big Sky Economic Development, the Chamber, and our community to do another Battle of the Plans competition, which did result in 3 new businesses downtown the last time they did that in 2017 and 18. So we hope to bring that back. But again, hopefully this year we are also able to do some travel, if that's going to conferences, if that's traveling to other communities to recruit actual new businesses to come in.
Thank you.
And Katie, did you say 15 or 50 new businesses?
50 over the last 18 months.
It's the last 18 months.
A very significant number that we were frankly surprised at when we actually started compiling this information. We had a significant number of new spaces that have been empty for a very long time occupied, which is really exciting, both on the second level and on the ground level. You might find if we were to walk around downtown together, and that is an open invitation to anybody, that there are actually very few ground level, sidewalk level spaces that are available to lease right now, which is really exciting. We're happy to see that happen.
You ought to get that story up on a very big billboard downtown. I think that is just absolutely great news. So thanks for passing that along. Okay, thank you very much. Other questions before we go to public comment on this item? Councilmember Ewell?
Thank you, Mayor. This is for Jennifer DeRay, if she's actually with us yet tonight.
Don't see Jennifer on the... Oh, she is.
Okay, so you're hiring landfill workers, solid waste, and I know last year when we were doing the budget talks, We had a pretty good discussion on people that always abuse the extra refuge or garbage, so the second truck had to come by and pick it up. And there's 2 people on the second truck, so it's and how many of those second trucks run every day? Is there like 2 or 3 second trucks, or just 1, or?
Councilmember Ewald, it depends on the day, but there's 2 or 3 that typically run.
So we got between 4 and 6 employees that if we made these people purchase a second canister that they used, that we could turn those people someplace else at solid waste and we wouldn't have to hire more employees. Is that a possibility?
Councilmember Ewald, what we're really looking at and trying to move forward with is a pay-as-you-throw system that would make everyone pay for that second can or for what they put out. But the first thing we need to do is transfer some of that service from the alley that's in those shared 300 containers to the individual containers before we can move in that direction. And then, yes, we could probably eliminate some of that extra service. However, I will tell you that we are severely understaffed at both the landfill and in collections right now, to the point where we are not running extras in the alleys, except for occasionally once a month. We just don't have the personnel to do it right now.
Okay, and so with the GIS system that you put in play, the person that's driving the regular garbage truck, if there's garbage there, they can load it up somehow and just bill people for it. Is that how that would work? Extra?
Councilmember Ewald, yes, we have Routeware as the system that we use, and we could use that to implement a system where we would charge people for those extras.
So are you still moving all the alley garbage pickup out to the streets, or did that get stopped and it's going back to some of the alleys that are through alleys?
Councilmember Ewald, we're evaluating the alley right now, and we will be switching some to curbside. You know, the object was always to address those alleys that we had safety issues or that just weren't able to be served well. So we're continuing down that path. Some are moving to curbside and some will be moving just to individual containers in the alleys.
Okay. And one more follow-up, please, Mayor, and then I'm done.
Sure, go ahead.
So we could probably be looking forward to a report on trying to get rid of the second trucks for next year's budget talks.
Councilmember Ewald, I apologize, but you faded out. I didn't quite hear that question.
For next year's budget talks, we can probably get a report on hopefully getting rid of the second trucks, maybe except for like once quarterly, they could come around and pick up big objects.
Councilmember Ewald, our plan would be in probably, hopefully less than a year from now, we come back with the full pay-as-you-throw presentation that would include what all that would eliminate or change in our services.
All righty, thank you very much.
Thank you very much. Councilmember Purington and Ronning.
Thank you, Jennifer, while you're on. Oh, you just went off. Anyway, so the question that I had, you said that you were severely understaffed. So are these new positions or are you trying to fill old positions?
Councilmember Purington, great question. Right now we have 5 open positions that we just have not been able to fill. Same problem that I think every department is having. We just cannot find people that want our jobs right now. But beyond that, we are definitely going to be more personnel at both the landfill and in collections just to keep up with the growth that we've seen in the city.
Thank you.
Thank you, Councilmember Ronning.
Thank you. This is either for Jennifer or Debbie. So a couple years ago, council approved that, I think it was $120,000 for a contract with KTVQ. Is that contract now done? Or is it continuing on for several more years? Can you remind me what's happened with that contract and how successful you felt it was?
Councilmember Ronning, that contract, I believe, ends in either September or October of this year. So our plan is to go out for RFP though, later this summer to get another proposal in for that, because we actually do feel it's been very successful for us. We have a lot of people that contact us and say that they've seen the ads. The other part that I don't know that anybody has seen on council is that they do a lot of direct mailing for us, direct emailing. So there's a lot of people that are getting information about Public Works that you don't necessarily see out on Facebook or on TV because they're just directly emailed.
Can I follow up with that? So will it be for another $120,000, or is it going to be for more? And that $120,000 is just for 1 year, is that correct?
Councilmember Ronning, that's correct. It's $120,000 for each year, and that price will be negotiated with the new RFP.
Okay, thank you.
Thank you very much. Council, let's go to public comment. We'll come back to the budget wrap-up, hopefully for some sort of a wrap-up. This is an opportunity for the public to comment on anything having to do with these budget discussions. Please come forward, and we'll look first at anybody who's here with us in the library, and then we'll see if there's anybody online. So welcome, and please tell us name and address, and ask that you keep your comments to 3 minutes.
My name is Catherine Card. I live at 2815 4th Avenue South in Billings. Mayor and Council, I've been before you several times and written to you a number of times as well. And I'm still asking you to consider my experience with the Billings Police Department in the last 6 months as you consider the budget. I want to make it clear I'm in favor of funding the police to whatever they need. However, if the police department here does not make some changes in how they handle certain cases, in how they handle documentation, and present honesty to the public, then the money will go to waste. So I ask you to fund them, but also to require some changes within them. As you know, I have had problem with them not documenting certain items. The CPSM report says that, calls it out for the records. Records were insufficient of audits of the evidence room, and documentation and following procedures for investigation, determining investigations of certain cases was done rather randomly by personal choice of the sergeants. Those are small items, and yet in my life experience, I have learned that small items sometimes trigger or indicate a larger problem underneath. My experience with the police department also this last 6 months after I was assaulted during the toy run, Road Dog toy run, and the police department refusing still to investigate it, is an indication to me that there is some kind of relationship that between the outlaw motorcycle gangs in this town and the police department, whether they're taking it easy on the outlaw gangs or not. I was assaulted by a galloping goose and in my car, and I just want to say that in addition to my situation, the police department does not investigate or permit runs that the motorcycle gangs and motorcyclists hold in the town. They don't do the regular permitting of any of them. And, but yet every other event is required to have permits. The Galloping Goose they are a dangerous gang. They are an outlaw gang. They're known to do drug trafficking and violent crimes. And it's important, again, I ask you to hear me and to consider the behavior of the police department in this little bitty case. But I think there's a lot underneath it. Thank you.
Thank you. Further comment? Any further comments on item number 3?
Good evening, Mayor and Council. Tom Ripsis, 105 Legends Way. I would just be remiss as the chair of the Parks Board if I didn't point out that you all just spent 15 minutes talking about the difference between a 1.04897% increase and a 1.03985% increase, which is a difference of 41 cents to the median household. On the other hand, there was virtually no conversation about the $5.76 that is going to be increased from the arterial street district, street maintenance districts, or the storm sewer district. And thank you for Councilmember Brown for pointing out the staff shortages in the Parks Department. Those could almost all of them, maybe 80% of them, be solved by $5.76 on the median household. So for 1 year, if we held the line on arterial street district, street maintenance, and storm sewer, and use that $5.76 on the parks maintenance instead, we could solve those staffing shortages. So it's just an imbalance there. When we think about the budget, we need to think about the impact on the taxpayer as a whole, and not think about enterprise funds significantly different than the general fund. So thank you for your time.
Thank you. Any other further comments from here in the library? Don't see anybody, so do we have anybody online who has raised their hand using the raise feature on Zoom? Please do so if you're online. Denise, do we have anybody out there who might raise their hand?
No, Mayor, we have no one attending.
Okay, then we will close the public comment period on item number 3. Back to council and to Andy. Andy, you're coming forward. It looks like you'd like some clarification on something.
Nope, just to provide comments if needed.
Okay, all right, thank you very much. I think we have addressed the PD 1 rate of increase, but we have not addressed the PIO issue definitively. Staff still needs some clarification on that. I'll point out, Councilmember Neese.
Thank you, Mayor. Andy, thanks for coming up, because I did have a clarification on your presentation. I don't know what page number it's on, but it's the tax and assessments section that has 2 different sections like that. Can you pull that up first? Got it.
Oh, it's the tax and assessment, the $7.99 something a year. I got kicked out of Zoom. Too much profanity or something, I think. Yeah.
Clerk, she'll be nice to
All over a typo.
I know.
So when you get to that, so just to clarify, because when you're looking at this, and I want the public to make sure if I understand this, or make sure they understand, or I understand correctly, is when you're saying that there's a decrease in the total mills that we're going to assess between 21 and 22 of 1.44 in that first section, that's really, we were assuming that.
And I apologize, Councilmember Neese, I think that's $1, not a mill.
I'm sorry, when $1.44, we're actually reducing the $1.44, and we're not increasing the general fund, we're not increasing any money coming in for public safety, library, and transit. Is that correct, that they will not see any increase in dollars on their tax bill at a median income for home? What did you say, $117,000?
$217,400.
So in 2021, that house would have paid $526.76 at 217. Well, whatever the median home value was at that time, because 21 median home value would have been 211.
Yeah, it was 211.
211. So 211,000.
Were you whispering to him? So
This was addressed in Councilmember Ewald's email.
Yeah.
So Andy, can you just address the difference there?
There's a lot of moving parts in determining what your tax bill is going to be for the median home. So in this scenario, the home is $217,400 in 21 and assumes it's still $217,400 in 22 to show what really what I want to demonstrate here is there an increase on your mill levy? And the answer is no. There is a decrease on the number of mills that will be levied by the city.
Well, you see total bills, but then you put $1.44.
Right, but the mills are a percentage, is just really a percentage, 1/1000th of your taxable value.
I guess the point here is the public needs to know is even though it says it's decreasing, it's not decreasing. Because as the Ewald's email said, is we're actually comparing apples and oranges in this particular one because they actually probably pay $502 and they're going to pay $525. So they are going to go up. And so by us saying it's actually, it's your estimation is 4.5%.
Correct.
And so really we're looking at, the public needs to know that the increase is 4.5% is what we're estimating this to be up. So I find it a little, not intentionally misleading, but it's a little difficult for the public to understand when we start talking about the saying in 21, when we look at the meeting in 21, we're actually using the 22 number in 20 instead of 21.
So I think Councilmember Ewald's showing you page 8 of your proposed budget book. It's a good page. It has what you are, I think, wanting to see, which is the median home in 21 and the median home in 22, two different values, and what that changes. Page 14 looks like this one
This
has the same value.
we assume there's a 4.5% increase across the board on everything. So to Tom's point about it increased $5.76, it actually increased 5.76, whether that's mills or
Those are dollars.
It's dollars, and it's really 4.5% more than that because you're using the 21 you're losing the 22 medium home value in 21.
With actually, Councilmember Neese, the 3 assessments, street maintenance, arterial, and storm, are not a factor of taxable value. They are a factor of zoning and square footage, but in very simple terms, it's square footage of your lot. And so if you don't change that, unless you have a bigger lot, which would only, you'd have to acquire more land, that would be the only thing that would drive up your value if council kept the rate flat. All the mill levies are a factor of your taxable value, and so is Park District 1. So those, the street assessments and storm sewer are all a factor of your lot size, not taxable value. So.
But again, going back to, all of those would have been, if you used the median home value of 20, an actual 21 value, you would have been a lesser amount showing it a bigger increase.
Correct. Yes. Whenever your value goes up, you are going to see real dollar increase, but that won't hold true for everybody. And we know that's a fact. The majority will see an increase.
I just want to make sure I understand the presentation. To me, it was a little bit.
Thank you, Councilmember Neese, for that clarification. That's you're accurate. We go to the PIO question. You raised the issue or the possibility, Chris, that I forget how you put it, that if we had good news on valuations in August, then we could possibly confirm PIO spending, but making some sort of inclusion on a conditional basis, I guess, putting it in. What would good news be that would make that clearer? In other words, something more than our current estimation of an increase of property value, which is about 4.5% is what we're operating on. So we're talking about an extra $80,000 to $90,000. How much would that have to go up in order to pay for that PIO position? I assume not a heck of a lot across the city.
It's less than 1%. I think it's between about 0.5 and 0.75%. So if we came in at 5 or 5 1/4, we would capture that 80 to 90,000 in the general fund.
Okay.
And Andy, I'm sorry if I could add to that. Would I be right in assuming that your answer to that'd cover the full 80 to 90?
Correct.
So by the time it's about a 2-year lag in total. But by the time the positions, because we charge out our fees on actual cost. So we don't charge public works or solid waste based on a budget. We charge them based on actual expenditures. So ultimately, once that cost is added, it'll be knocked down by about 40%. as it's paid by, as that overhead charge is charged out. So probably 0.5% might actually, once it's fully operational, cover that additional cost for that position out of general fund.
Okay, but you need to know now what to do in this budget. So how do we do that? Is the question. You can think about that. I see a lot of hands up, so I'll just go from left to right. Councilmember Brown and Ewald.
So I guess my question to Andy, Bruce, whoever, is we're talking under $100,000 to add this PIO. 40% of that we're assuming is going to be paid across by all the departments. So really it comes down to administration. Does it save administration $50,000 in your guys' time by having this person? And if the ROI isn't at least break even, maybe I agree, maybe we wait. But if the ROI comes out, it would make sense that if you guys save $50,000 of your wages on a PIO, it makes sense.
I think it's an additive service more than it's a cost savings. So, just use the last 24 or 48 hours as the latest example. I didn't take the time to notify any of you when I got the text at 7:39 and then came downtown here and was going until 4 in the afternoon. If I had a communications person like this, one of those added services would be, okay, hey, the council needs to know where we're at. I didn't stop in the middle of the road and I could have or should have done that maybe. So I think it really is not going to save time as much as it's going to provide more service to the public and you guys in our community as to what's going on administratively and organizationally, for us. Thankfully, we have a really solid public information communicator in the police department who we pulled in to cover this. That's what Mr. Woolley was doing for us. He covered that for this incident. So, but I didn't take his time to say, hey, notify council. He was certainly notifying the media when we set the press conference time. It's we cover the essentials, maybe that's bad for me to say, but the absolute essential components, and I'm not thinking as much as I wish I had somebody who was on point, always thinking about the communication, not just the decisions that need to be made.
Councilmember Ewald, Councilmember Ronning.
Thank you, Mayor. I gotta agree with Penny on this. That the qualifications should include grant writing expertise, because when we took the vote here the last time, that seemed to be the underlying reason that the vote passed, is the fact that the grant writing deal, one grant would be all it would take to pay for that position. So that would be one of my recommendations, that unlikely grant writer needs to be crossed off, and maybe not the actual grant writer, but at least have the skills to help the rest of the staff write a grant and get it done right. So, thank you.
Thank you, Councilmember Ronning and Nice.
Thank you. I guess, I had some thoughts of my own, but really want to comment on what Sean just said. I guess I see this position as not just a service to administration, but to all of the departments. What we just heard, and I asked that question specifically about the $120,000. That's $120,000 for one department alone for 1 year that we're going to be spending just to talk about public works to the public. Airport asked for over $63,000 for a staff member to market for the airport. That's just one department. And when we look at what a coordinated position could do, especially when we've heard from repeated numbers of department directors that, one, we can't get enough people in the fire department that want to work overtime. Police department. We struggle with fleet maintenance when we heard that they can't get enough people to even apply for entry-level jobs. Parks, exactly. We heard from Chris Kukulski tonight that our fire department got 27 applicants, more than any other department for a department director position in the largest city in Montana. We have a communication problem. And because we're a great city, we have great departments, but we've got to communicate this to the public, not to mention to one another. And I agree with you, Chris, about yesterday. When I showed up at the press conference, first of all, I was surprised that it was just Mayor Cole and I that were there. But my feeling on it was because the rest of the council didn't even realize or know that we, thankfully, to our fire, to our Billings Benchwater, to our police department, that we escaped a very critical situation that could have happened in our city. And the rest of council, I don't think even knew it. And you know, maybe you saw, but we all really should have been there. But really been informed of what was happening. And we as council need to learn how to do better. I speak a lot to high schoolers. A high school group that I spoke with that got onto our website and said they don't even understand what the city council job is. They don't even know what we do. What are we even working on? We've got communication in regard to that we have to work on as well within our city, especially going for public safety mill levies, talking about all of these issues that we're dealing with. And I think that we need to do better at communication, and I think it's a really good investment that will see improvement over time and pay for itself. So I've said that over and over again. I'll get off my soapbox. So thank you.
Thank you, Councilmember Ronning. You know, I'm going to do something I don't usually do, which is just make a motion here because it's 10 o'clock or close to a council, and I did recognize Councilmember Dees and Puritan's hands. My motion is that we direct staff to include a PIO coordinator, whatever title city administrator believes, in the budget, that person's job description includes something to the effect of having grant writing skills to provide assistance to other departments. Also, development for director, or how to ask the community for money for the city, but also the staff may come back to us to reconsider this in August, depending on dollar amounts. But it would be part of the budget. But if we didn't hit that 4.5% number. Staff come back, let us know whether we want to reconsider this. Hopefully, we wouldn't have already hired somebody at that point, but that would be the motion. Is there a second to that motion? Councilmember Ronning has the second. Discussion on the motion. Councilmembers Neese and Purington.
I have a discussion on the PIO, maybe the motion, but I guess I was surprised when I heard the press conference that we had our public information officer speaking at that time. I thought that's interesting, but we do get a lot of notices from the fire information officer, and we get, like Penny said, we got the public works. So within multiple departments, and I'm not sure if the parks has their own, they've got some kind of coordinator, volunteer coordinator, whether they serve as their public information, I don't know. But there's a lot within the departments. We have a lot of different departments kind of acting as PIO, and I'm not even sure if this is a budgetary item other than just taking the amount of money that they're spending on these individuals and saying we're going to rearrange that money instead of having a particular PIO for the police. We're going to have PIO for the city, and you're going to be funding it. And so, budget-wise, it shouldn't even impact the budget other than maybe some admin, small amount. But if we're talking, I think what your memo was. By the way, I wouldn't. If the description we're voting on is for what's in this description here, I'll vote opposed it. But if it was a $90,000 amount, by the time you're looking at a budget amount of what you actually maybe need is probably only $30,000 or $40,000, because you're going to pull from other departments to fund it, because they're all going to share those, including public works, and so they would be funding that, and you wouldn't fund the $120,000. So that's mine.
Okay, thank you, Councilmember Purington.
And that was my
And then Councilmember Brown, sorry.
Roy, was that if you pull all of the departments and what they're doing within each department, whether it's the public works and their mailers and their television ads and all of that, would that budget, would they still do that? Or would they rely on some sort of communication coordinator? I'm sure the police department, they will keep their person. I think that was already mentioned, I don't know, a couple of weeks ago or whenever we talked about it, that they would keep theirs. But I have the same question as to whether or not which of the departments would let go of what they're already doing. And then on top of that, a grant writer is a very expensive person, and it takes a lot of time. And I have an issue with having a PIO that is also a grant writer. Because I think with all the communication that does go on within the city, and if you're combining all these departments to do that, then you're asking them to do grant writing on top of that for, these different departments. I don't know that $90,000 a year would pay for someone that would do that much work. So I'm not real confident in what we're asking, and I think there's too many unknowns as to what the other departments would be doing, or is this, we tell them, well, no, you don't do any of the KTVQ, we'll do it, through admin, and so I need some clarification on what would happen with the other departments.
Okay, Councilor Brown and Shaw.
Thank you, Mayor. I think it's really important to understand we're talking about an information officer, not a marketing person. Two completely separate things. I think the information that we saw was 40% would be paid, approximately 40% by the other departments. So that's 60% that public or the general fund would basically be paying. So we are looking 50,000, 60,000, whatever that might be. To me, it comes down to what value does that bring? What work does that take off of everybody? And certainly, what does that do for the integrity of the council, the integrity of the city? I think that there's a lot of value as of late to talking about the things that have been done well and not just, reports on ditches getting ready to burst and, things like that and public shootings. But the great things that this city does, the reports that we just got today about what a great fire department we have and how well it's managed. And honestly, the changes that were recommended in the big scheme of things are pretty small. So that does speak a lot to how well the fire department is being managed. The police, really the same thing. We don't talk about that, but what's the value of that, right? Is that worth $60,000? And I guess over the past 2 years, I fought the PIO every time, and I've really kind of changed the way that I look at things. I think that Mr. Rusmus brings in a really good point, that this could be a point person for communicating with city, county, any of these other departments. And right now, how many times have we talked about we need to better our relationship with the county? What a better way to have than somebody full-time on it. So I will support this, and I do hope that the administration would come back and say, look, we just can't get it in the budget this year. But realistically, we're talking $50,000, $60,000. And I think the return that we'll get for just getting the information out there, talking about funding, talking about mill levies, talking about all those kinds of things, it is certainly worth $60,000 to me. It's just such a small amount in the broad scheme of things that I'll support it.
Okay, thank you very much. Somebody else had their hands up, Councilmember Shaw and then Neese.
Thank you. Councilmember Brown made all of the points that I was going to make, so I'm obviously supportive of this. I'd like to call the question.
Second. Thank you very much, and we will vote on whether to vote. We need 2/3 of the 10 who are here, so 7, I guess, will be the magic number. If in favor of voting, proceeding to the vote, please raise your hand. Voting in favor of proceeding to the vote are all members with the exception of Councilmember Neese. If voting in opposition, please raise your hand. Councilmember Neese votes in opposition, understandably, because he was going to say something, but that's okay. All right, we'll move to the, so the motion is to include in the budget Superman or Superwoman who can do everything. I meant to say it was a certain amount of discretion on the part of the city administrator, of course. It may not be possible, but it's at least part of the job description. Whether it can actually happen, we understand there are limits. If in favor of the motion, please raise your hand. Voting in favor of the motion are Councilmembers Yakwich, Cole Tricky, Brown Ronning, Joy, Ewald, Shaw. If voting in opposition, please raise your hand. Voting in opposition, Councilmembers Neese and Parrington. Motion passes. Thank you very much. Anything else, Council, before we move on to item number 4, public safety mill levy discussion? And then we do want to talk about the status of the BBWA ditch situation. Anything else, Council or staff? You're the ones who we're trying to provide direction for.
Yeah, really, it's there, as I mentioned, as a placeholder just in case we really needed to cover something on the public. I'm sorry, are we still on budget?
We're still on the budget. Anything else on the budget item that you want us to address tonight?
I think we're good. So I appreciate it. We'll get that in for June 28th.
Thank you.
Thank you.
Okay, thank you very much.
5-minute break.
Yeah, Councilmember Brown, 5-minute break, absolutely. Then we'll come back and quickly handle items 4 and some discussion, and we'll be done. If everybody can take a seat, we will get started. Get started, everybody. Okay, we are back live now. This is continuation.
Recording in progress.
Welcome back, everyone. We have concluded item number 3. This is June 7th. We're now on item number 4, public safety mill levy discussion. We do not have a presentation on this, but it would be helpful for city administrator or budget director to give us sort of an update on where we're at with our public safety mill levy efforts, and then also if you would introduce our new 911 coordinator there, Chris.
So Mayor and Council, let's start with that. We should have done that before we got into fireworks. So we got 3 of our leaders from the fire department here with us. Chief, you want to go ahead and do the introductions?
Absolutely. So I'm not sure if you guys know Chief Hopple already. He's our Assistant Chief of Operations. And then Mr. Yeager, I think, is who everybody was really interested in. Sorry, Matt. Derek, you want to come up? So Derek comes to us with extensive background, both federal and state, in regards to wildland fires. So Derek had 20 years with the DNRC, is that right?
I was 12 with the BLM and 10 with the state. So.
Yep, I knew I was close. So Derek also has a lot of communication background and has taken over our 911 center as of December, and we have already noticed a tremendous turnaround with that facility, and has informed us that we haven't been tapping into its true potential, so we are very excited.
And that was a tremendous turnaround, not turnover.
Yeah, did I say turnover?
Right?
Sorry.
Okay. I want to be clear about that. Well, welcome, Derek. If you want to give us your words of wisdom, feel free. But
I don't know that I have any. This one kind of caught me off guard, but I'm sure excited to be here. I think, just from my perspective, there's a lot of potential, a lot of work to be done. But it's really exciting, and I look forward to it. So thank you for having me. Appreciate it.
Thank you.
Welcome.
Thank you.
As was certainly clear from both reports, and we all know this, right, that the call comes in first to the dispatch center. And the dispatching of services, I think, is going to look a lot different 5 years from now than it looked 5 years ago. And that's obvious, and that's not just for the fire department, it's for the police department, kind of all services across the board. So Derek was involved in the budget process this year, which was great. And I hear a lot of really helpful things from someone who has spent 20 plus years on the other side of the communications piece, adding a lot of value to what we're trying to do to improve, kind of service delivery. So that's kind of that team. And highlight, or just to summarize, as late as we're getting, next Monday, per the motion that was made back in May, you'll have first reading available to you for the public safety mill levy for the November 2nd ballot. So that packet probably goes out tomorrow because we were still making some adjustments to the cover memo for this out.
Yeah, we did get it.
You got it. So there's first reading for the 14th. I will highlight, we just didn't pull a number out of the air. The fire number there, the 1.1 million, was from implementing the CPSM recommendations, not inclusive of Fire Station 8, but there are still increased investments in fire services to implement the cost side. I counted them up. They don't all have money attached to them, but of the 34 recommendations, I jotted 9 of them are policy areas, and the other 29 are really operational. The money side necessary to deploy the medical response squads or teams, whatever we call them, whether they're funded through internal personnel that we have or external, the dollars that Andy and I and the fire department work together on were to be able to implement the plan, the cost sides of the plan. So we talk more about that. We'll be prepared next week. Each department affected, police, fire, prosecution services, code enforcement, and court, we're all asked to present to you. You know what the numbers are on the people. We've given that to you numerous times. You know what the dollar is. I've asked them to come and bring forward to you what it is that implementing their strategies are going to do to improve and reduce crime, make our community a safer place. And I'm convinced if we do that well with you next Monday, then you'll be voting yes on the public safety levy. And the 28th would be the second reading of that and the actual, I think, language for, there's two documents we got to approve on the 28th. One, the ordinance and the resolution coming on the 28th. The other summary you'll see in the memo. We had a subcommittee. We tried to duplicate, frankly, last year's subcommittee that spent some time working on that ballot language. Helped us again this year with some of your peers to put the language together for this year. So, yeah, you'll read that in your packet, and that's kind of the main thing for next Monday night as far as if you choose to keep the public safety levy moving forward. Almost hesitate to say this, it's not a mandate for Monday. Remember, there is a drop dead set of timelines, but frankly, the ideal is to stick on this timeline so we have an extra roughly 30 days to educate rather than wait until the full end. But our backs are not up against the wall this Monday for the first reading. But if we're ready to go, I hope we take the step and we're clear about which direction we're headed. I'll leave it at that.
Okay, thank you, Chris. Questions or discussion? Councilmember Brown? And we do all public comment on this item.
Thank you, Mayor. Chris, I just wonder on the contract negotiation with ambulance service, do you anticipate that would cost the city any more to kind of beef that up and get some better response times?
We did not put any money in the in the fire side, expecting that we would need to somehow incentivize or pay an outside entity to provide services.
Okay, perfect.
If I can just comment, I think that's a really important question, though, because and if we can look to other cities and what's been their experience, I can see if I'm the ambulance company, I can say, well, now some of these duties are being performed by two of us, and you want us to perform all of them, so how do I get paid? If, as Tom said, there's opportunities for them to get paid in ways other than transport, they might see that as a way to make more money than they've been able to in the past, too. So I don't know how that cuts, but that's a big factor in all this, it seems to me. But I don't know what's good or bad on the budgeting side. Further questions or discussion? Councilmember Neese and Ronnie?
Thank you, Mayor. And to Councilman Brown's point, I do, in your point, Mayor, I think that is an important question that we should find out if there is going to be any cost to the city, because that was one of the chief's number 2 priority was to get that contract worked out. And so I think that we need to find out really how we're going to do that and address that before we have to go back to the public and say, well, we need another million or not. But to Mayor's point, I think from what I heard from the report, that they actually just may want there'll be a competition to come to the city because they're going to make more money providing some kind of services other than just transport. But I would like to see that question brought answered.
Councilmember Ronnie?
Thank you. I had a kind of the same question in regard to a potential contract with an ambulance service as well. And I guess it's not only just the idea that what could or could it not cost the city or how would it be cost effective, but I guess I'd also want to know, and I don't know if this is something that the city can answer or if some other cities can answer, but back to the individual person, if they're required to take an ambulance well, I guess they can't be required to take an ambulance transport, but if they're required to take ambulance services versus city services from a fire department, will that have some type of impact on either homeowners insurance or vehicle insurance, or will that have an impact on the individual, just on the individual cost to members of our community? So I guess that would be some information that I would want as well, if it's possible to get.
I'm extremely doubtful that we will have information on what a contract looks like between an ambulance provider in the city and us within a week. I don't think we'll know that for 6 months to a year. I mean, this has been a topic of discussion, I think, in the community for years. You have an ordinance that guides it now. The recommendation is you should go to a contract with more teeth and more clarity as to role and responsibility. I'm also not expecting it to all have a huge shift in what our costs are. Maybe that's wrong on our part, but I don't think in the next week, unless we're expecting them and mandating you can't function in our community unless you do X, Y, Z. Those are negotiations we're going to have that'll take many months, I think, to work through, or it'll just stay the way it is right now relative to what you have in place as regulations that guide the private sector in providing that service. And I'm getting a little nervous that all of a sudden this issue could be perceived or used as maybe derailing what we would do to make decisions relative to what should the public safety levy look like in this upcoming year. But maybe with some time over tomorrow and this week, these guys will help me kind of see that better.
Thank you, Councilmember Ewalt and Brown.
Thank you, Mayor. You know, this fire report, it's got a lot of really, really good stuff in it. I think one of the last things Mike said is you can cut 25% of the calls off this boom just by doing one little thing. You take 25% of your calls off, that frees up a lot more time, and everybody's worried about those trucks being running around town. Well, there's reasons they run around town on first aid calls instead of sitting at the station and taking something else. And I was looking at the miles on the engines. It looks like about 10,000 miles a year. What wears out faster on those fire engines? Is it the engine, the motor, the chassis, or does it have to do with the pump and the plumbing and everything meeting the qualifications to be a first-line pumper? So we're running these pumpers 18 years. That's a long time to have a first-run pumper that you're dependent on to save somebody's life in somebody's house. So I don't think we're overrunning the engines. But there's all this information in here. We just got it. The first time report was tonight, and we're out there trying to raise $1.1 million without even sitting down and putting a complete plan together and going, well, maybe we should look at this, or well, maybe we should look at this instead, or let's go this way. I've always been under the assumption that when they came to us with the paramedic deal 2 years ago, it was to subsidize AMR. AMR is supposed to, I thought, according to what I understood, they're supposed to have 3 rigs available in the city at all times. Is that right? And they're not doing it because I see them run by my place out by Shepherd. They're running by there. They're not in the city then. And I've seen 2 rigs go by, so I know they don't have that many stationed in the city if they're taking 2 out there. So I think we need to get a contract and make them put like 5 or 6 ambulances on there. That way we don't need them. They can put personnel on way cheaper than we can put firemen on. And so I think both the fire department and the police department. We need to sit down and the police have to sit down and get together with staff and with the council and the fire department and come up with a plan and go, this is what we learned by doing this study. Otherwise, why did we do this study if we're not going to sit down and really concentrate on this stuff? And if we're not going to have the vote until November, it doesn't make any difference if we run a public safety and have it in May. We're still not going to get it till the following November. That'd be the first payment. So that gives us some time to sit down and study this, and we can go to the people out there and say, this is what we want to spend the money on. Right now, it's just like, well, we did the study, but this is the only part of the study we're looking at. And so I just think we need to spend some real strong planning time and listen and read and look at the stuff that they're giving us in this, that we spent the money on to have them do it for us.
Thank you very much. Councilmember Brown and Shaw.
Thank you. First of all, I want to say that I'm not wanting to postpone our discussion and our vote on a public safety mill levy decision. Okay, I think that we've had the information. The city administrators had this report for a couple of weeks. And honestly, even before that, because his mill levy that he brought to us included some of this stuff. So I think that certainly, I believe the city administrator and his team have certainly given this a lot of thought and a lot of consideration. Agreed, we just see it tonight, but it certainly matches the information that he's given us, in my opinion. As far as the contract with the ambulance, guys, I honestly don't know how that works now. Okay, I don't know what we pitch in, what they pitch in, what we should, what we shouldn't. I am in agreement somewhat with Councilman Ewald that it seems like we're starting to subsidize for AMR. Okay, we've now got, the medics working at the fire department and distributing medicines, things like that. Now we're looking at having a couple of teams now doing the same thing, because we get there in minutes and it may take hours for the ambulance to show up. Okay, that's my concern, I think, more than anything else, is can we get that service level? Because he made a very good point. He's not going to do ambulance only if he doesn't know they're going to show up. That makes perfect sense to me. That's my concern with the contract. And is that going to cost us any more money? If we don't believe it's going to cost us any more money, I don't think we postpone moving forward with the mill levy. I honestly just don't know. You want to talk about ignorant, I'm beyond that. So I really want to let the council know my intent is not to hold this up. I think we have to move forward. I think it's been pretty well thought out. We've really fine-tuned this. I mean, it's down significantly from where it was before, without cutting a lot of services. So, I really ask you guys not to hold this up on a contract with an ambulance service that may take us a year to work out or better, because now we're going to be really in the hole in a year if we have to go back out. I think it's fair to ask, could you guys look into it? Is there a significant cost increase possibility?
Okay, any other discussion on sort of the status of our public safety mill levy ask before we go to public comment on that? Councilor Purington.
My understanding with AMR is basically their transport. That's the biggest thing with AMR. And so I can see where the fire department and they have some sort of a medical response to any sort of incident that requires medical emergency. And that's kind of how I look at it. I still think there needs to be a contract with them, because when I read the ordinance, it's like, that means nothing. And And I also read where AMR does go out into the county. They probably go beyond. I don't know who told me, but I thought that AMR doesn't really make a lot of money, that they're kind of struggling. I don't know if that's true or not. So for the fire department to augment that, I can understand that. And I don't know how long you would have to wait with a patient that needs to go to the hospital because you cannot transport and you have to wait for AMR to do that. So does this hold up, the public safety mill levy or what we're going to put towards it? No. But my biggest thing is that I too will agree with Councilmember Ewald is that we are getting these reports. And I think you just said you were going to put 1.1 into the fire department. Well, what if we need 3.1? Because, I'm not confident in the numbers at this point. And I know I don't know all of the numbers going into that. So I'll reserve my decision on, how to go about that until we hear more about it next week, I guess.
Thank you very much. Councilmember Shaw, did you have your hand up today?
I did, but Councilmember Brown made the point I was going to make, and I just want to reiterate, please let's not hold this up, Council. Please, please, please.
Thank you. A comment I just might make for staff, this whole we don't want to we're pretty well deep in the contract AMR weeds now, but that's pretty specialized information about how Medicare and Medicaid reimbursement rates work, how these contracts might work. And I'm just wondering whether there are consultants or experts, if not in Montana, somewhere in our region who have been down this path before. And it might be worth asking around, looking for that, because we could maybe save a lot of time and money and get a better product by getting some guidance on that issue, if such a person or organization exists. But okay, let's open up for Councilmember Neese, and we'll open up for public comment on this item, and then move on. Councilmember Neese?
Yeah, I did have, I tend to agree with Councilmember Ewald regarding the plans. Although we as council had them and we've read through them, I don't think there's been a whole lot of time we as council got together and discussed it and had debated on the fine points, or should we go this way or that way. And so I would like to have seen more meetings before we go into suddenly a public safety bill levy, and that we can explain it to the public. This is why we're doing it, because I can't explain to the public today why we're going to do this and this. I hope by the end of I think you said you're going to have your staff come and talk to us. I hope by the end of that time I can explain that to them but I don't feel confident in that. And then the other point I'd like to make is I was on the committee that helped kind of go through the resolution. We'll see next week. But I think there was some discussion that we never addressed in the committee. I think the council should look at it, and even the report tonight didn't, as Council Member Shaw asked, is when should we build that fire station? And they've never answered when you should do it, other than when the call services are up. And this public safety mill levy ask is going to include a lot of mills for that, which I think when we get to that, I don't know if you've addressed, I don't think that should include that, because there's no support for that within this report even. So my opinion is we should pull that out of that, the ask, because we don't have concrete evidence to include it in this ask.
Chris, you want to comment on that?
We're trying to move on. I would encourage you, so recommendation 2 of the report is the medical response teams. So I read that section and it tells you what pages to go to there. So I'd look at that again, please. Secondly, maybe overarching, none of this was ever about taking over what AMR or any transport entity does. That is a whole different discussion. I've managed some cities that do that, but that's not Billings, and that wasn't Bozeman, that was Kalispell in Michigan. So that's a whole nother animal to say, hey, should we be the transport ambulance service versus AMR? This is none of this about displacing anybody else. This analysis is about what your fire department is doing today and yesterday and before that, based on the policies and direction of itself and the policy body there. So we're not looking to displace or replace what someone else is doing. for sure. And so, yeah.
Quick follow-up on that.
And I'm sorry, lastly, one last piece, which is the recommendation we had bifurcated it, does not include Station 8 personnel because these numbers don't show a need for station. It does not say of any clarity where Station 8 should go. So we really would be guessing where to put it. And when you put a station down for 50 to 100 years, you don't move that station. So I do think unequivocally you need a lot more information to determine where and when the station goes in based on the recommendations. The intent is fully implement the plans that were given. So we'll talk more of that in detail next week.
Thank you, Councilmember Neese.
Yeah, just one more point on the contract. I agree. I think a contract would take a long time and maybe too long for but just the basic understanding of it. And the other thing is, as they mentioned in the report, is with the contract, we can hold them accountable. Today, we really can't hold them accountable for anything. And when they show up and they tying up our medical team, our engines for an hour, waiting for them to show up, that contract can have teeth to actually make them reimburse the city for that time. And so those are the kind of things I think that, and maybe it won't cost us anything, maybe it will, but in the end, I think it's going to provide better service for our residents when we have something that they have to abide by.
Okay, thank you very much. Council, I'm going to open up for public comment on this item, number 4. For anybody in the library tonight who would like to comment on our public safety mill levy discussion that you've just heard, please come to the podium. Is there anybody in the library who would like to comment on item number 4? Seeing none, Denise, is there anybody online who might want to comment on item number 4?
No, Mayor, I have no attendees.
And we will close the public comment period on item number 4. Council, are we ready to move on off that item? Looks like we are. So, council discussion, Councilmember Yakovich and Councilmember Ronning.
Thank you, Honor and Council. I just wanted to give our condolence to Mr. Iflin's mother-in-law who passed away. Her funeral was today, and also his mother-in-law was Rich McFadden's wife, who was our councilman, Ward 3 before. So our condolences to you, Mr. Iflin, and to Rich McFadden and all the family.
Thank you very much. Other items from the council before we turn it to Chris for an update on the BBWA ditch situation. Councilmember Purington?
Yeah, I've had 3 different sources come to me. And so, Chris, I just wanted to ask, I understand that there's a major building project that has fallen through because of the requirements for recode. And I don't know if that is true or not. I've heard from some pretty good sources that is true. So that is an element that I think we need to look at next month whenever we look at Project Recode.
I'd be happy to share more details in the project. And actually I had a conversation yesterday night with the landowner, so to my knowledge it's not done, but we agreed to meet Wednesday morning. It's either tomorrow morning or Wednesday morning.
Okay, good.
Continue to pursue the conversation. And it really, in all due respect, has to do with where a building is placed on the lot. That's the bottom line, and frankly, I'm asking them if they can help us continue to elevate in design quality, and they've got banks all over the northwestern United States that fit our new design standards. But it is a different design standard than we've asked people to do in the past. So we're trying to work through that between the property owner and folks who want to build. So I hope we can figure it out for sure.
Well, in continuing that conversation next month with Project Recode, I don't know that there are any statistics or any numbers that show things that have not been built because of the regulations in Project Recode.
And I have no idea. We can have that conversation to bring information to you. So.
Thank you.
Okay, thank you. Chris, what's happening with the BBWA ditch?
All right, so we'll try to hit this at an awfully high level. So you're aware now of that yesterday morning, kind of covering the timeline in brief, at the 6 a.m. check, apparently there's 2 checks a day by the Billings Bench Water Association on the ditch levels. They found a blockage in the ditch, which was causing a backup because that blockage was right at the tunnel, which is the funnel point to go through the rims. So they did everything that needed to be done, as well as did our personnel from police, fire, public works to immediately respond to that incident. Thankfully, the BBW was able to break that loose and then instantly start seeing, that water table go down. But before that happened, there started to become a breach of the dam, and it started to undermine and put about 10% of the water down into that northeast neighborhood. So we'll spend, what was said yesterday by the canal folks is probably 15 minutes longer, and we could have lost the entire ditch. Now, there are certainly plans in place. We don't regularly talk about them on Monday nights, but everything that happened in the past 24 or 36 hours wasn't by accident, right? KC, the emergency service providers, public works, all within minutes were doing what they needed to do to respond to this situation. So the blockage was resolved, but it did cause some damage to the ditch, and they're working they being the BBWA is working to repair that, and expect frankly to have it repaired and the ditch back on by tomorrow. This issue really is completely separate from a complete other subject, which is that the land, the material, the ground in this part of town along this ditch has been moving, maybe for hundreds of years, but there's a fair amount of conversation about, especially the last 5 or 6 decades, there being some consistent movement there. So separate from this, we've been working on stabilization of the canal wall, or not really the canal, but the subgrade, the ground underneath of it, as it is technically city land. Some parts of this ditch that run through the city happens to own the land adjacent to the ditch, and other places we don't own the land. In this particular location, before the ditch heads into the rims, there's a fair amount of public land around the ditch. And we're trying to stabilize that ground as we've had a geologist in immediately. This is not Debbie's first rodeo, right? I've only been here 3 years, not even 3 years, and we've dealt with this already twice in my 3 years. They've got a team of people they immediately bring in of geotechs and experts in space. We were out there 10, 14 days ago on a Wednesday night after we flew them in, and they're telling us, okay, there's a serious movement here. It's all being measured. And the bottom line is we were convinced if we didn't do something to stabilize that wall, we could be the cause, or the ground would be the cause of the ditch, failing. And if the ditch fails from a ground movement, just like it could have failed from this backup, you're talking about catastrophic flooding and life and safety event. So that work is going, that stabilization work by GSI, Castle Rock, and SK Geotechnology, who we've been using for years, helping us on these kind of issues. It'll take us about another week to a week and a half, maybe 2 weeks to finish the stabilization project. In essence, the mayor kind of nailed it. It looks like what you see when you drive the Beartooth Highway, of netting to capture rocks and keep things from coming down. This is a system to hold the hillside up. It is kind of in oversimplified terms, a way to kind of stabilize that hill. Back to cleanup here, sorry, kind of going back and forth. We probably have a couple of weeks worth of work to do, mostly on the public works side of the house because of what happened yesterday. all the inlets get filled with silt and dirt, and there was, public streets, they were there this morning doing cleanup, and they'll probably spend a couple weeks before they have it fully cleaned up from just a few hours of water coming over that breach. I think that probably covers kind of the immediate. The contracts I've signed contracts, assuming that retroactively you'll need to review them and approve them. In that, didn't view that we had a choice but to stabilize this wall and risk, losing the canal. Whether we ultimately fight with who should reimburse us or whether that's our cost, that's more work to be done relative to the liability on the ground stabilization. But really, that's totally separate from the last 36 hours of activity relative to the blockage. They're two separate issues, coincidentally, in the same part of the ditch area. Long term, I think it's been communicated to me from the ditch company that they have been in communication with the governor's office as far back as 6-8 months ago about CARES Act dollars and ARPA dollars as being something to help resolve this issue. We've certainly out there over the last 24 hours talked a fair amount about, hey, it's in our best interest and their best interest to collaborate. There's 17,000 acres, tens of millions of dollars of agriculture ground to the east of Billings. And there's a pretty substantial neighborhood and business activity that goes up in our northeast part of town that would be flooded if there was a catastrophic failure. Is this an opportunity for the federal government and state government to help fund something that would reduce this risk and help ensure those farmers and those ag users that got a higher probability of that water for the next 100 years and lessen our risk associated with a flood, in Billings. So that's kind of the latest and literally day to day. Debbie and her team has had to divert a fair amount of time and effort that we were, trying to focus on ARPA and grants to deal with what was a crisis that 10 days ago, 14 days ago was on none of our radars, but had to drop and deal with. So.
Okay, thank you, Chris, for that. Appreciate also your devoting your Sunday to the effort and more than that as well. Since I've been up there a couple times, I guess I'd like to just make a few comments and then turn it over to council if they've got any other questions for Chris or other staff members. Kudos, hats off to the Billings Fire Department and Billings Police Department for their great response, especially the fire department, who is the incident command organization here. Just did a great job Sunday. Also to the quick response by the Billings Bench Water Association. Their quick action saved what could have been a much worse situation. So again, hats off to them. One observation I would have is that I do not think it's our duty to maintain someone else's ditch. So, but I applaud the quick action by the city administrator and staff in bending over backwards to protect health and safety to the tune of lives and potentially millions of dollars. And sometimes you got to do what you got to do here. But I do think we want to be a little careful about not becoming a volunteer in taking care of somebody else's ditch. Both because it costs us money, but also because if it goes wrong and we've done something that somebody can criticize, we've perhaps created some liability that we don't want to. So I think we need to proceed cautiously. It is our duty to provide full access to the BBWA so that they can repair on our property. Just because it's on our property doesn't mean that, again, I think we've got to maintain it, but we do have to provide them access. By Montana law, they've got a secondary access easement to go on our property and do whatever they got to do. And we want to make sure they know that they've got full access to our property to do exactly that. I guess I think our city attorney should look into this and see whether she agrees with my thoughts on this. And if she does, and the city administrator do, that we put the BBWA on notice that we might look for them for reimbursement. And that, very importantly, if they don't like what we would do to maintain their ditch in this emergency situation, that they tell us. And that we're going to assume that everything that we do is 100% with their consent. And that if it's not, that they'll immediately let us know, and that they're endorsing any actions that have been taken thus far, so that they can't later point their finger and say they would have done anything different, Lee. And then if there's any disagreement on responsibility here, that we consider at least filing a declaratory judgment action. We can ask a court to decide whose responsibility this is. I hate to do that, though, if we can just cut a deal with the ditch company. But the first priority, it does have to be protection of life and safety and millions of dollars of property that are downhill from that ditch. And one thing we do know, if there is a breach, there's such a great slope on that property that it is going to erode very, very quickly, and that situation is going to evolve pretty quickly. So those are my thoughts. Other council members have questions or comments on this topic. Councilmember Neese.
Thank you, Mayor. I do agree with you of everything you said. I will add to the fact that I am concerned now we have a responsibility now, or a liability to actually maintain the work that we did do to stabilize the hill. So if we don't maintain that for some reason, we could now be liable as a city because we didn't maintain the stabilization. Similar to when the rocks fell off the rim, that wasn't our land that fell, that was property owners about to have fall in our land. I think the property owners need to be responsible for their property. That's part of the advantage of having that beautiful view living up there, and that is their cost associated with that. And so I do think that we need to make sure the ditch is aware that we should not be maintaining their ditch. It's an act of God that land moves. I mean, we can't prevent that. It's just the way the land moves. We think we live in solid ground, but it's moving all the time. So I agree with the mayor, and I hope that we are reimbursed for this money that the city spent on this.
Councilmember Ronnie?
Thank you. Sorry. Kind of agree, kind of don't agree with what was just said, but yep, land moves, and this is now really the third, whether they're separate incidents or not with this ditch, this is the third real big issue that has come about with this ditch in the last 2 years. The earth is talking, and I hope we're listening. So I think that while we can have a discussion, and we need to have a discussion on costs and everything else, but we also need to do what we were talking about earlier with the CPSM, is we need to start working in partnership, and what we've been talking about for a number of years now with the different parties that have some sort of something to do with this ditch, whether it's the county, whether it's the Billings Benchwater Association, whether it's whomever else, the state, whether it's our state legislators. There needs to be some oversight on this ditch, but also the earth is talking to us. And I hope that we're listening, and that we're not going to just wait and be responsive when something happens, but that we're proactive to say, yeah, this may cost some money, but we need to make sure that this ditch is absolutely stable and work out the details. But it's talking to us.
Thank you very much. Councilmember Joy and Purington.
Thank you, Mayor and Council. City Administrator Kukulski, do you have a feel that obviously over time ditches need investment in order to be maintained? And do you have a feel for the Bench Association having the money to make the investment to make the ditch safe?
I honestly have no idea what their budget capacity is or their resources that they've allocated for maintenance of their facility. I don't know how strong it is or how weak it is.
Thank you.
Councilmember Purington.
So I have two questions, Chris. One, do you have any sort of an estimate? I know you said that you signed contracts. Are they giving you any sort of an estimate of what they're talking about financially?
Yeah, we're talking in the neighborhood of $500,000. We're talking about I think a $380,000 contract to do the stabilization work. And then I want to say there's another $50,000 of engineering work and that. So I'm just going to round it up and say I think we're probably at close to $500,000 to do the stabilization that the geotechs have recommended on our ground. So recognize all of this ground above the ramp in this location and below the ditch, above the ditch, on up the rim and below it in this location is city property.
So you made the comment that you've contacted the governor's office, and just as Penny made the comment, this might be a perfect time to contact our local legislators because it does have to do with agriculture in our community, in our county. So this might be the perfect opportunity because I know they're doing meetings in Helena and see if they can actually work towards helping the city fund that or the canal.
So just to clarify, so the BBWA was in touch with the governor's office. We have not been on this, but certainly I communicated willingness and desire to work together with that. Part of the drone footage we took over yesterday, I asked our folks who are doing that, hey, be thinking of, we need to be able to tell this story going forward. And the mayor and I happened to be, we took a call from Senator Daines' office and certainly took advantage of the opportunity to communicate with them that we think there's a greater opportunity here to provide a more reliable, fix for this, for the ag community and for the city. So,
thank you.
Thank you very much. Anything else on that item? Not seeing anything. So any other items of council discussion before we go to public comment on non-agenda items? Not seeing anything. So we'll open it up for public comment on non-agenda items. If anybody is with us tonight who would like to comment on anything that was not on our agenda, please, which would include this ditch item, this is your opportunity. Any other public comment on non-agenda items? I'm not seeing anything, so 11:02, we are adjourned. Good night.